So good evening, everyone. I would like to call this meeting to order. So welcome to the New York City Health and Hospitals public hearing. Please note that we have Spanish interpretation services available. Instructions are available. Registration is open until 5:30 p.m. and the registration table is located in the lobby of the auditorium. If you wish to submit written remarks, there is a staff member and a comments box in the lobby. Your written testimony along with a transcript of oral presentations will be shared with the members of the board of directors. So my name is Jose Pagan. I'm the chair of the NYC Health and Hospitals Board of Directors and the chair of the Capital Committee. I would like to take this opportunity to introduce the other members of the board who are here with me this evening: Sally Hernandez-Piñero, Rita Wang, and the President and CEO of our system, Dr. Mitchell Katz. Also, on this panel are Andrea Cohen, the Senior VP and General Counsel and the moderator for the evening, and Colicia Hercules, Secretary of the Corporation. This hearing concerns the proposed lease by NYC Health and Hospitals to the Fortune Society, Inc. for the development of Just Home, which will provide permanent residential affordable housing in Building 2 at NYC Health and Hospitals Jacobi Medical Center, together with certain surrounding land on the campus to be used for parking for the building. The building will include affordable and supportive housing units for both the community and patients who are medically complex and formerly incarcerated, as well as a live-in supers unit. So today, there are over 1,600 units of affordable, supportive, and senior housing on NYC Health and Hospitals campuses in Brooklyn, Manhattan, Queens, and Staten Island. No project has been developed on Health and Hospitals land in the Bronx to date. Just Home is part of our new citywide Housing for Health initiative, which serves patients who are experiencing homelessness by connecting them to affordable homes and housing. It is also supportive of the city's commitment to affordable housing for all. As the developer of this project, the Fortune Society is highly respected. It's a highly respected not-for-profit housing developer and social services provider that has provided high-quality social services for 55 years, transitional shelter for 23 years, and permanent housing for 10 years. Fortune is seeking to develop 83 units of permanent affordable housing, including 58 units of supportive housing, 25 units of rental housing, and one live-in supers unit in an underutilized building. This housing will serve adults who are medically complex and formerly incarcerated and have been determined suitable to reside independently in supportive housing and low-income individuals with a preference for local community members. This public hearing must occur prior to NYC Health and Hospitals Capital Committee and Board of Directors authorization allowing the President to enter into a long-term sublease with the Fortune Society, Inc. Additional approvals by the Office of the Mayor and the City Council must be obtained pursuant to New York City Health and Hospitals Enabling Acts. I would like to thank all of you for participating in today's public hearing. We look forward to hearing your comments on this matter. We will now have a presentation by Stanley Richards, Deputy CEO of the Fortune Society. Thank you, Mr. Richards.
While they're preparing the screen, let me just first thank you for the invitation to present Just Home and introduce Fortune to this community. But before I do that, I want to just take a moment and just reflect and appreciate this full circle moment for me. I was born and raised in this area. This hospital was the hospital I was born at. My family was born here. My mother passed away here. And this area is the community I still live in. I live right there by Kingsbridge in Bedford Park. So this is a full circle moment for me. I remember this community when we had horse trails up and down Pelham Parkway, where you can go on the weekend and rent a horse and ride up and down Pelham. So this opportunity really presents a full circle moment where I could see the place that I was born 63 years ago see themselves as part of the solution to helping people with complex medical needs and criminal justice involvement find a place in the community, find a home to build a life, find a home to stop cycling in and out of the emergency room and homeless shelters. So I am grateful to be here tonight to share with you all about Fortune and some of our work. I want to go through the history, our housing portfolio to date, some testimonials, talk a little bit about the just home development, and then talk about our partnership with health and hospitals. Let me start off by describing how Fortune got started. We are a 56-year-old organization that was started in 1967 by an off-Broadway producer and theatrical agent, David Rothenberg, who produced a play called Fortune in Men's Eyes. It was a true story of a Canadian young man who went to prison and was assaulted and raped and experienced all the brutalities that happen in our criminal justice system. That play, at that moment, spawned a conversation between the people who were coming to see the play, the actors in the play, and community members about the realities that people experienced while they was incarcerated. That conversation led to David creating the Fortune Society, a place that he wanted to create to give voice to people at that time that were voiceless, to give space and support for people to do the things that they wanted to do when they came home but found it nearly impossible to do, like get a job, have a place to live, go to school, raise their family. To date, we have over 16 program areas, including housing. We have a policy and research center to ensure that the services and experiences of those we serve are being elevated to a level where policy changes can happen and reform can happen. We don't want to be the safety net after all the trauma and damage happens to communities and individuals. We want to be part of what stops it by including policy changes. We served in FY23 over 11,000 individuals who came and sought our services and sought to create a better life for themselves and their family. On any given night, we house about 800 people that are no longer in the shelter, that are no longer on the streets, no longer cycling in and out of jails and prisons. Our mission is simple, but deeply profound. Our mission is to support successful reentry from incarceration and promote alternatives to incarceration. By doing those things, we strengthen the fabric of community. Because we know that when we help people rebuild their lives, when we help people get connected to family and services, when someone has a job, it increases their likelihood that they'll never get involved in the criminal justice system. We have multiple sites where we provide services, but our main service center is in Long Island City. And there we provide a range of services: case management, helping people navigate the multiple systems that they need to interact with, including probation and parole. We provide employment and education, help people enter the workforce and earn a livable wage. If people are interested in education, helping them get their education. We provide benefit access, mental health, licensed mental health, and licensed substance abuse treatment so that people who suffer from addiction and mental illness can get the care that they need, the medication that they need to live stable lives. We provide food. Many of the people we serve reside in food deserts where you can find a McDonald's and a Burger King and a White Castle on every other block, but don't have access to healthy food. So we provide healthy food. Youth and peer leadership, because we know when we help people see their potential, that translates into potential for their families and their communities. We have arts and tech and digital equity. At our Bronx Service Center, at Castle Gardens in Harlem, and our supervised release in the Bronx, we provide similar services. Our model is no wrong door for entry and lifetime aftercare, which means after you've come in and after you've received services and you stabilize, the price of admission is paying it forward. And that might be paying it forward in your community. It might be paying it forward at Fortune. We want you to pay it forward. We started doing housing in 2002. We went through a strategic planning process around 1995, and we realized we were providing education and employment and substance abuse treatment, but people were living on the streets and they were living in shelters, and their ability to maintain their sobriety, their ability to get up and go to work while they're living in a shelter was a huge impediment for their stability. So as an organization, we said, we need to respond to that particular need. Our response to that need was to build housing. And in 2002, we opened the Castle, which is called the Fortune Academy. It is on 140th Street between Broadway and Riverside. We provide 90 emergency and transitional beds. Emergency means that people come in, they get access to all of our services, and the goal is to reunite with family, get their own place, to have permanent, stable housing. The Castle has been identified as a model program. It is listed in a number of places as a model. We've replicated that model in Syracuse with a sister organization and looking to replicate Just Homes after Castle Gardens. Castle Garden, another housing program we opened, when we purchased the Castle came with a lot that was behind it. And we had a choice. And the choices were, one, we could sell it because at the time, land prices was going up. We could have sold it for about $9 million and used that money as an endowment. Or we could have done something for the community and for the people we serve. And we went to Community Board 9 and we said, what is it that you need? And at the time, Columbia was buying up a lot of land. Families were not able to afford that community. And they said, we need housing for our family. And so we went and built a joint venture, which is called Castle Gardens. It is affordable and supportive housing. It's 63 units of supportive housing for people with criminal convictions and homeless, and it's 50 units for the broader community. The units are spread throughout the building. It's one living super. We have 20,000 square feet of program space. We have space for Community Board 9 to have their community meeting. Castle Garden is now a polling place, so members from the community can go there and poll. It is a resource both to the people we serve and the community. Since we've opened Castle Gardens, and we've been open now 13 years, going on 13 years, 88% of the residents have been in that building for 2 years or more. 72% of them have been in that building 5 years or more. And the average length of stay in that building is 8 years. It is a beautiful building. There's 24-hour security in the building. There's camera coverage in the front and throughout the building. There is activities for tenants of the building. And people don't want to leave. That is a place where people have grown roots and become part of the community. And we're really excited about it. Barbara is one of the first tenants who moved in. Her and her daughter lived in a family shelter. And when we opened Castle Gardens, they came in and they toured and they was looking at their apartment. And you can read Barbara's story. But I remember when her and her daughter was looking at the apartment and her daughter said, "This is really nice. Who is this apartment for?" And Barbara said, "It's for us." And at that moment, you begin to realize how important housing is for people. That Barbara and her daughter couldn't imagine something beautiful, something safe that was for her and her mother. I am so glad to report today, Barbara's daughter is grown. She is in college. Her mother still lives with us. And they are doing well. They are doing really well. And we are thankful for that resource being available to them. When we opened Castle Gardens, we said to the community, we want to be a resource to the community. We want to be good neighbors. We gave them my cell phone, Joanne's cell phone. We said, if there is any concerns, you can call us and we'll respond. And we developed such a great relationship that Community Board sent in a letter supporting the pursuit of opening up Just Home. And I want to just read a piece of it. It says, the Fortune Society has been a strong community neighbor since moving into our district over 2 decades ago. Throughout the process of establishing its emergency and transitional housing at the site, Fortune was fully transparent and available to address all questions about its services to support individuals returning from incarceration. Because of its exceptional record, we were further pleased when it opened up an adjacent permanent affordable housing residence 8 years later. The residents and Fortune Society have proven to be assets in the neighborhood, hosting meetings for the community board, as well as the entire community. And I am thankful to Community Board 9 for taking a leap of faith and trusting us and supporting us. It didn't start that way, but that's the way it is right now. And today, as I said, Castle Gardens is a polling place. Community Board 9 meets there every Wednesday. We do a food distribution program where we serve over 200, mostly seniors from that community, where we give out fresh produce and eggs and cooking instructions on how to make fresh and healthy meals. We have really become partners in the work to see the best in each other and to lift each other up and not to define us by our circumstances or the worst decision we've ever made. And so simply put, we work with Community Board 9 to see the beauty in people, even before sometimes they see it in themselves. And I am proud of that relationship and look forward to establishing that relationship with this community. We have a building we opened up for seniors called the Mandela. In 2022, in partnership with Bronx Pro and the United Methodist City Society, we opened the Trinity Reverend James Senior Apartments in Morrisania in the Bronx, on Washington Avenue. It is 57 units of supportive housing for formerly justice-involved seniors. It is in a larger building that has about 150 units. we have 57 of those units dedicated to people with criminal justice history. Again, a little story of someone who was in a shelter and now lives in Mandela. And these testimonies are really important because the conversation we want to have and the project that we want to build is not about bricks and mortars. It's just not. It's about people. It plain and simple is about people. And those stories matter. No one in this room would want to see a loved one out on the streets in trouble, cycling through a system of despair and hopelessness. We all have the capacity to see people in their best. And that's what we want to do here. We have two projects that are in development. One is called Castle 3. It's in Harlem, East Harlem. It's going to be 82 units of affordable and supportive housing. And you'll hear throughout all of the projects we have, we've learned some things about doing housing. Our first housing was emergency and transitional, all for people justice impacted and homeless. The other buildings are all mixed use, meaning that it has to be a resource for the people we serve, but it also has to be a resource for the community. And so Castle 3 is going to be that. We're doing Castle 4 up on the Upper West Side on 97th Street. We purchased an illegal hotel, and we're going to convert that building into 59 units for formerly incarcerated homeless individuals, and again, 24 units for the community. Every one of our buildings will have community units for members of this community and any community that we open up our buildings in. Talk to you a little bit about Just Homes. Just Homes is an amazing vision of a project. As a man who came from this community, as a man who was formerly incarcerated, born in this hospital, as a man who was recently the first deputy commissioner of the New York City Department of Corrections, I can tell you there are people in that system who this city doesn't have the capacity to house when they get released and doesn't have the capacity to care for them while they're incarcerated. They have complex needs, but not complex enough that requires hospice or some other long-term care, and a system that is not designed to really support them. And so for years, our partners, Correctional Health Services and Health and Hospitals, have been trying to figure out how do you build capacity to serve folks who fit this particular criteria. And they pushed through, they talked through, they figured out, here's an opportunity for us to do it. On a building, on a Jacobi campus that could be retrofitted to accommodate people with complex medical needs and partner with a nonprofit organization to do it. And so we are in partnership with the New York City Health and Hospitals and the New York City Housing Preservation and Development to create housing for people with complex medical needs and homeless and formerly incarcerated, and units for the community. Just Home will have 58 permanent supportive units for formerly incarcerated, medically complex individuals, and 24 studios for the community that is open for rental at 60% AMI, and we'll have one unit for a live-in super. Each unit will have a kitchen and a bathroom, so it will be independent. The partnership, as I said, is between Fortune, who is going to be the developer and service provider, New York City Health and Hospitals, who will provide the ground lease, and New York City Housing Preservation and Development, who will help fund the capital and construction. Tenants in this building will have access to licensed clinical social workers, peers, and specialists to provide intensive services. We will partner with health and hospitals to ensure people have access to health care as a preventive measure and not the emergency room as a routine way of accessing health care. We're going to have ongoing health assessments. We'll have benefits access, case management, and care management to help people meet their needs. We'll be helping with daily living activities and peer support and behavioral health and transportation so that people can get to and from their appointments as needed. The building will have 2 community rooms, including a resident test kitchen and culinary training center. It will have a nurse's suite, so if people need medical care, they can have medical care on site. And we're going to have 24/7 security, residential aides at the building. This is a typical floor plan. The entrance to Just Home will be on the Jacobi campus, not on Seminole Avenue. It will be on the Jacobi campus. And this is a typical layout of a floor where there will be units. There's going to be office space for staff, and people will be able to access services as needed. The development timeline is we've just created draft floor drawings for the building, finalizing the number of units that'll be there. In 2024, the Health and Hospitals Board will vote on the ground lease. Shortly after, there will be a New York City Council vote, and then we need to submit the paperwork to the New York City Department of Buildings for the permits necessary to begin construction. We anticipate construction to start in 2025 and occupancy in 2026. This is not a new build, so it won't take 18 months. This is basically doing a retrofit for the building. And we look forward to ongoing conversations about this project, about who we are, and how we can support people with complex medical needs who are homeless and have justice involvement. I look forward to hearing your comments, and I look forward to ongoing conversations and eventually your partnership. And I'll close this presentation with an abbreviation of a poem that really stuck out for me over the last 6 months. And that is, society sometimes draws a circle to shut people out. But love had the wit to win and drew a circle large enough to let people in. Let's let people in. Thank you.
So thank you so much, Mr. Richards. Now I'm going to turn the meeting over to Ms. Cohen.
Good afternoon, everybody. I'm Andrea Cohen. I'm the Senior Vice President and General Counsel at New York City Health and Hospitals, and I will be moderating tonight's program. I first want to just mention to those of you who didn't hear it before that we do have Spanish interpretation services available, and there is someone in the lobby who can help you if you would like those services. I also want to note that registration for speaking, for those of you who want to speak, is open until 5:30 p.m., so that's just about 40 minutes from now. The registration table is also located in the lobby of this auditorium, and you have to register in order to be able to speak this evening. As you just heard, this public hearing concerns the proposed lease of Building 2 on this campus of New York City Health and Hospitals Jacobi Medical Center, together with some surrounding land on the campus for parking, by New York City Health and Hospitals to the not-for-profit organization, the Fortune Society. And as you heard, the building will include affordable and supportive housing units for members of the community and H&H patients who are medically complex and formerly incarcerated, as well as a live-in supers unit. We'll be hearing testimony today about this proposed lease. All testimony that is heard today or written testimony that is submitted today will be transcribed and forwarded to all members of our board of directors for their information and consideration. And as you know, we have 4 members of our board here listening live as well today. Registered speakers are allotted a maximum of 5 minutes of speaking time. So I want to just talk a little bit about the rules of the road since we have many speakers registered to speak this evening. This is very important. Right over here, I'm going to point. There is a timer that will be set at 5 minutes for each speaker. It'll start out green. A yellow light will indicate when the speaker has 2 minutes of time remaining, and a red light will signal that the speaker's time has elapsed, and it will shortly go into flashing red light. At that time, I will interrupt the speaker if they have not already concluded ask them to finish their sentence. You can submit any additional material that you have in writing, and we will ask you to step aside for the next speaker. We do have a long list of speakers, and I will enforce the time limits strictly. There's a staff member in the lobby and also a comment box. So anybody who either would prefer to just submit written testimony or who doesn't have a chance to finish their oral testimony can submit any additional material into that box or give it to that staff member in the lobby. All of that information, all comments that are received tonight, whether in writing or oral, will go to the same place, to our board of directors. I want to note, we have already, should I read the name? Okay. We have already received a large number of written comments, and I just want to recognize those individuals who have submitted comments. I will just read through them very quickly. Serena Griffin, Vivian Kim, Betsiti Araya. I haven't gotten to the part where I tell you I will do my best with pronunciations. Safaya Samad, Emma McGill, Maxwell Ackerman, Mark Shee, Neil Miller, Judith Clark, Elizabeth Denny's. Those individuals have already submitted written comments, and obviously we will take many more this evening if you would like to submit them. In order that we can move quickly through the list of people wanting to share their views, I will, with each speaker, I will call the next speaker, the person whose turn it will be, and the person who will be following them. The goal is to get people to be able to be both prepared for your testimony and to be located close to the two microphones on either side and on either aisle there for when it is your turn to go. We can reduce the amount of time between speakers. I apologize in advance if I mispronounce any names. Please correct us for the record if I get it wrong. We are all looking forward to hearing your views, very important views this evening. Thank you for your participation, and let's get started right now. Our first speaker. Okay. Got it. Okay. Our first speaker will be Zak Caro Jr., an assembly member for the 80th District. And following that will be Judith Clark. So you can get into position. Thank you, Assembly Member Zak Caro. Go ahead.
Good afternoon. I first want to take this opportunity to thank every single resident of this community who has shown up tonight and who will show up later to continue to, push the needle here and making sure that your voices are heard. For those of you who don't know me, my name is Zak Caro Jr., and I'm the New York State Assembly member for the 80th District, which includes this proposed location of the Just Home project. I am deeply disappointed that this public hearing is scheduled on a weekday at 4 p.m., making it challenging for our hardworking community members to attend after work and for families with children. This timing suggests nothing but a lack of transparency and consideration for community feedback. And if you continue to hold meetings like this during a time that is clearly inconvenient for the public, I will continue to serve as their voice. Since the inception of this project, I have dedicated significant time to engaging with my community, listening to their concerns. And the truth of the matter is that the New York City Health and Hospitals, the Fortune Society, and the City of New York have failed to be transparent, leaving our community frustrated. In September of 2002, your FAQ, you emphasized that the Just Home project is the city's first supportive housing for formerly incarcerated individuals. And my question remains tonight: why does the Bronx, especially our community, continue to serve as the testing ground for such developments? Projects like the one we're discussing here today should involve all stakeholders who have a responsibility to engage our constituents with transparency and with respect. Yet at every turn, in response to every question asked, our community has been given the runaround. I understand that proponents of this project would argue that this community hasn't done enough. That Community Board 11 has only built 58 units of affordable housing. But that's not the real reason why Just Homes is being developed here. This project has everything to do with the city's need to draw revenue from an unoccupied property on city land, and therefore here we are. With this property, we have a genuine opportunity to make meaningful impact on our community. According to the most recent census, 2,352 veterans live within the 80th Assembly District. And according to the VA, many of them face housing insecurities. My district is also home to 18,600 seniors. Many of them, 65 and over, who live in our district live below the poverty line. These are vulnerable residents who have served our country and deserve housing in the communities that they've contributed to and the communities that they call home. If the Fortune Society and the New York City Health and Hospitals care about our most vulnerable populations, a facility to house these individuals should be the only option. And if we want to continue talking about important community needs, why are we the only borough in New York City who does not have a blood center, even though we have a renowned level 1 trauma center right here at Jacobi Hospital? Blood donations in the Bronx have decreased by 28% in the last 3 years due to no dedicated blood center. And I can go on and on with what our community needs, like a youth center and much more program space for our community. But again, I'll reiterate as my time comes to an end, I have concerns about the Just Home project. Our community shares these same concerns. And with one voice, we strongly urge you to reconsider this project. With numerous people in desperate need in our backyard, our priority should be to use local resources to address our community needs first. Thank you.
Thanks for your comments. The next speaker is Judith Clark, and after that is April Cardina.
Thank you for allowing me this opportunity to speak in support of the Fortune Society's planned opening of Just Home Housing in collaboration with Health and Hospitals and the Department of Housing Preservation and Development. My name is Judith Clark, and I am the Community Justice Advocate for Our Children, which provides transitional and permanent housing and family reunification for women transitioning from incarceration. We know firsthand from our work the dire need for housing and services for people in reentry who are medically vulnerable. Over the years, women have come to Our Children who have or developed serious medical issues that we alone cannot address, and we have been confronted with the scarcity of suitable alternative housing for them. Fortune Society's Just Home program is the answer to our prayers and the prayers of many individuals who seek stable, permanent housing close to needed medical and other resources. As a reentry program for women, we partner with Fortune Society on a regular basis. I personally know both women and men who were able to get their fresh start living in Fortune's current housing programs, both the Castle and Castle Gardens. And many of our participants have benefited from the programs and workshops that Fortune Society provides. In the same way that Our Children has become a critical asset to the Queens community where we are located, so too Fortune's housing and programming are a boon to both directly impacted individuals and the surrounding community. Coming home without a stable place to live is a scary prospect. Faced with complex medical needs, such as stage 4 cancer, and needing a place to live is all the more difficult. The wraparound services that will be provided behind the individual and the community will provide needed apartments, not shelter, for leaving jail. Fortune Society is both innovative and collaborative in its problem-solving approach. This can be seen in the Just Home design, a collaboration of New York City Health and Hospitals, New York City Department of Housing Preservation and Development, which will draw on the medical resources of Jacobi Hospital while providing ancillary resources that can lessen the burden of care for health and hospitals. Potentially at-risk individuals will become stable members of the community and their families, thus enhancing public safety. In addition, this initiative will provide needed permanent housing units for other eligible individuals from this community. Our Children wholeheartedly supports this innovative and much-needed plan to address a serious need for permanent housing for medically vulnerable individuals emerging from jail. We look forward to celebrating its opening. Thank you.
Thank you. Thank you very much for your comments. The next speaker is April Cardina, and after that is Darren Mack.
Good evening. My name is April Cardina, and I'm speaking on behalf of Council Member-elect Christy Marmorato. I will be serving as her Chief of Staff, hence the representation today. Christy could not make it due to a positive COVID diagnosis, and so she would like me to read the following statement on her behalf. As Council Member-elect, I will represent many of the people here tonight and within our community. These same members have adamantly opposed this project, and with that, I cannot and will not support it. I encourage you to listen to them as they speak today and as they have spoken, because I have, and they have been adamantly clear and quite loud. I will represent many of the healthcare workers in the surrounding medical community. Having served this medical community myself for 16 years, I know and I have been in contact with many members of your own staff here on the Jacobi campus and on the Montefiore campus. They're concerned for their safety with the implementation of this project. They will not come forward due to fear of retaliation and endangering their job security. I will represent the thousands of children and parents that attend the 16 local schools within the 1-mile radius of the Just Home Initiative. These parents continuously spread and tell us the great concern for the safety and well-being of their children. The mission statement of the New York Health and Hospitals states, commitment to protect and promote as both an innovator and advocate for the health, welfare, and safety of the people of the city of New York. It's disheartening to realize that the Just Home Initiative does not align with these principles. It fails to promote or protect the interest of our constituents, healthcare workers, and children of District 13's community. Let's be clear that this opposition to this specific Just Home Initiative is not a blanket objection to housing or affordable housing. This is a plea for a more thoughtful and beneficial approach to helping other populations in need of housing. This location, for example, would be perfect for affordable senior housing, a place where our seniors can transition away from apartments that they can no longer afford and have the Jacobi facility present for any of their medical needs. Another practical idea for this location would be to house victims of domestic violence, where men, children, and women are running from dangerous environments and can be placed into housing while they find safe and permanent homes. Finally, and undeniably important, is the opportunity to see one of our most neglected populations housed, our veterans. These individuals and their families have sacrificed everything, some even their lives, in order to protect our freedom. It's about time for us to start caring for their needs with regard to both housing and medical necessary needs. When I decided to run for this position, it was primarily due to the strong and vocal opposition of this project at hand. Our community used their voice. Our community values openness, responsibility, and meaningful conversations. But unfortunately, they felt they had lost all sense of control and had no ability to speak on this issue. They had no influence. We appreciate the mission and commendable efforts of our local hospital, but implementing this specific project would be at odds with our collective support as a community. Now, we look forward to working collaboratively to reshape this space into a resource that enhances our community's well-being while adhering to the values expressed in your New York Health and Hospitals mission statement. Together, we can build a future that not only provides housing, but also a project the community can and will actually get behind. Thank you.
Thank you. Thank you for your comments. The next speaker is Darren Mack, and after that is Wendell Walters.
Good afternoon. My name is Darren Mack, and I'm a co-director at Freedom Agenda, which is a member-led organization dedicated to organizing people and communities directly impacted by incarceration to achieve decarceration and system transformation. I want to share a little bit about myself. I received my bachelor's degree in social studies at Bard College and my master's degree in community organizing and policy at Hunter College. I have participated on panels and presentations at colleges and universities like the University of Pennsylvania, Harvard University, and more across this country. I've been published and been interviewed for my advocacy by media outlets, from the New York Daily News to the New York Times. I'm the youngest of 5 boys, of 2 loving and supportive parents who have been married 63 years this month. They escaped the racist, segregated Jim Crow South to come to New York, seeking an equal opportunity for themselves and their children. But unfortunately, I'm also one of 750,000 people in our city who have been impacted by the criminal justice system. I was incarcerated at the age of 17. I accepted responsibility, served my time, and still, no matter how much I've achieved for the rest of my life, I will be impacted by what is called new Jim Crow policies and practices that discriminate against people like myself who are formerly justice involved for what happened when I was a teenager. In December 2021, New York City launched the largest public policy survey in our city's history. And it said that across all income levels and races, New Yorkers named housing as their first priority for creating safe neighborhoods. So on behalf of Freedom Agenda and our members who have loved ones that's been impacted by the justice system, we support the Just Home proposal because we believe that housing is a human right and the most marginalized and vulnerable people in our city need help. Thank you.
Thank you for your comments. Next speaker is Wendell Walters, and the speaker after that is Ricardo Garcia.
Good evening. Good evening. My name is Wendell Walters, and I'm the manager for policy and advocacy. Thank you, Judy. I'll start again. My name is Wendell Walters. I am the manager for policy and advocacy with the Osborne Association. Osborne is one of the largest and oldest criminal justice service organizations in the state. We have offices in Harlem, Brooklyn, Buffalo, White Plains, Newburgh, Troy, and our headquarters is in the Bronx and Westchester Avenue. We serve 10,000 participants each year from arrest to reentry. We also have programming in 41 state prisons and on Rikers Island. There are currently 31,000 people incarcerated in New York State prisons and about 6,000 in New York City jails. This includes an aging population that continues to make up a growing proportion of those in custody. Each year, thousands of people are released who have served their time as our court system. Many are returning back to their families and communities, but far too many are returning to shelters and unstable housing. In recent years, more than half of those returning home from state prison entered the overburdened New York City shelter system, transitioning from one institutional setting to another. The same goes for those on Rikers Island. Finding a stable housing during reentry is by far the most important issue confronting these individuals, as most lack income and are persistently discriminated against because of their conviction history. This dire need for stable, affordable housing is why groups like Osborne and the Fortune Society, with the help of government, have increasingly pursued opportunities to create housing for this community of people. Organizations like Osborne, Fortune, Our Children are there in the facilities to assist individuals as they reintegrate back into society and support them with programming and extensive case management. In the coming months, Osborne is set to open the Fulton Community Reentry Center in the Bronx. Similar to Fortune's Castle Gardens, Fulton is a 140-bed transitional housing facility for previously incarcerated older men who've been away for many years and need time to reacclimate to a changing, fast-paced digital world and who would otherwise be homeless. While transitional housing is critical to support reentry, finding and creating permanent and affordable supportive housing for the previously incarcerated is equally, if not more important, as it provides long-term stability. Osborne's Marcus Garvey Supportive Housing Program in Brooklyn is an example of a project that provides that stability. Marcus Garvey has 52 apartments, which are permanent, supportive, affordable housing for previously incarcerated older men and women. Residents take solace in knowing that they have a place to permanently call home, where they can also receive support and connect to services and resources. Fortune's Just Home project promises to offer this critical stability and support and rightfully addresses the housing needs of a segment of those incarcerated on Rikers that does not get enough attention and needs more support, individuals with complex medical conditions. Just Home will create permanent housing for those complex medical needs and those who need assistance with daily life activities and who would otherwise experience homelessness or be in homeless shelters that cannot meet those medical needs. Shelters are ill-equipped and unable to provide the necessary care in these cases, and without a project like Just Homes, individuals will be left to survive on the street, which is inhumane and can lead to unsafe conditions and situations. Without Just Home, individuals have no recourse but to seek medical care through the ER, like here in Jacobi, which is the most costly way to get health care. Just Home has smartly partnered with Jacobi, New York Health and Hospitals, CHS, HPD, to develop 58 units of supportive permanent housing for these individuals who need convenient access to medical care. The project also provides 24 units, as Stanley was referring to, of affordable housing that the city so desperately needs. We understand the community might have concerns about security. However, it is important to acknowledge the humanity and the medical condition of those who will be moving into Just Home. Fortune, Osborne, and other groups that provide housing for the previously incarcerated also take security very seriously and take all necessary steps to ensure safety. Fortune has more than a decade of experience operating reentry housing programs in ways that contribute positively to the surrounding communities rather than bringing disruption or negativity. From our experience at Marcus Garvey, those who return home from incarceration want to focus on creating a stable life for themselves and their families. The individuals who are to occupy the units at Just Home want the same thing as their neighbors do, to live fulfilling lives in a safe and caring environment.
Will you please conclude your remarks? Time's
Thank
expired.
you.
Great, thank you. If you want to submit anything else in writing, please feel free to do so in the lobby. Thank you for your comments. The next speaker is Ricardo Garcia, and after that, Ronald Colangelo.
Vertically challenged. Right. Good evening, everybody. Good evening, New York Health and Hospital Corp, and good evening, attendees. My name is Ricardo Garcia, and I'm here to propose an alternative to the current proposal of Just Homes. But first, let me introduce myself. I'm a United States Army combat disabled veteran that served 25 years. I deployed to Iraq and several other operations throughout the world. And I advocate tirelessly for our veteran population, not only within the Bronx, but within the entire state of New York. And veteran homelessness is still an issue, unfortunately. So one of the biggest issues that our veteran population has faced is in addition to reintegration and returning from services, is securing access to healthcare and homelessness. In New York State, the U.S. Census notes that there's 665,257 veterans as of 2021 living within New York State, and of those, 144,558 reside in New York City, according to the Census Bureau. And many of these veterans have been diagnosed with health conditions that have adversely impacted their ability to live fulfilling and healthy lives. In addition, as a result of these conditions, some veterans' ability to secure adequate housing have been hindered as a result of these medical conditions. While many strides have been made federally, through the state and through the city to reduce the veterans' homelessness, unfortunately, in New York City, sadly, we still today have many veterans who don't have access to housing. Excuse me. Congress has gone to great lengths to fund the Veterans Administration, and several programs that exist within the Veterans Administration. Some of these programs are the HUD-VASH, which is Housing and Urban Development, VA, and Veterans Administration Supportive Housing. The SSV, which is Supportive Services for Veterans Families. And then there's a Grant Per Diem program. And I'm just going to give you some numbers so you can see the kind of funding that's going in. In 2009, $376 million was invested to combat veteran homelessness. To date, Congress has provided more than $2.8 billion to these programs. $2.8 billion to fund any initiative that would support veteran homelessness. With that being said, the James J. Peters Medical Center, their senior leadership would and is willing to work with New York City Health and Hospital Corp to redirect the initiative, the housing initiative that you have here to benefit our homeless veterans within New York City. So if your board is amenable, so is New York James J. Peters VA administration to work with you, on, funding and helping your organization to provide housing for the veterans. Okay? So, something to think about.
Comments? Thank you for your comments. The next speaker is Ronald Colangelo, and after that is Grace Marrero.
Evening, how's everybody doing? I'd like to say that I'm for the project. That's a joke. Like this project's a joke. You want to move people into the neighborhood. Your gentleman here says, oh, well, yeah, it's going to be great. But what if it's not great? 11,000 people. Was it really 14,000 people? We had 3,000 failures. You don't need to know about that because we don't fail. We're going to do it. These other two gentlemen that are running projects, are they a mile to the nearest drug center, methadone clinic from where this building is going to be? You don't think some of the guys aren't going to kind of fall off the wagon and instead of making a turn going towards Pelham Parkway, they're going to make a turn and go to the other way? But that doesn't happen. That's never happened. But again, they don't want to talk about that. I know they're going to be shocked that I watch both sides of the bar. Another comedy. They should get an Emmy. Oh, we don't need more cops. We need street lights. Street lights, because there's no crime during the day. The street lights will prevent it. They have a lawyer that works for them that was formerly incarcerated. And he goes, well, I don't think my neighbors would worry that I was in jail. He's a white guy living down on Park Avenue. He isn't telling them that he was arrested. He's just saying, I don't think they would mind. Then the other guy that came on, it was white racism that made me go to jail. So, of course, the guy running the show doesn't say anything about that. He just keeps going and going and going. And you just sit there, you're like, wow. But they don't want to talk about Mr. Compass either. Another man that took in some of the formerly incarcerated ex-cons, or what they want us to believe, model citizens. Because they've been in jail, they're out there, they're model citizens. The model citizen they put in Mr. Compass's house assaulted his wife, got Mr. Compass arrested when he stepped in, and it was this whole big thing. But, we can't move it. It's COVID. That's how it goes. Because after they do what they do, they're done. And why? Because they have people that come and go, oh, it's going to be great. It's going to be great. But like I said, they put 11,000 people we helped, but I guarantee you it's 14,000, and the other 3,000 that maybe busted some old lady's jaw, robbed a store, beat up a cop on a train station because he told them to stop smoking. That's how it is, because we're here. You can't move us out now because we're here. We're in. And like I said, the two gentlemen that are helping other formerly incarcerated people, great. But like I said, they're not less than a mile from the biggest methadone clinic in the borough. Let's see how many guys stray. They cry that they need to close Rikers Island. Seems that one guy died. He died. Man OD'd on heroin. How is he getting heroin on Rikers Island? What is it? Just fly in, he has a bird, came in, dropped it. Oh, we have a lot of deaths. There's so much room on Rikers Island. Some of the officers made a clubhouse of one of the closed buildings. Since they're working so many hours, instead of taking 2 hours to get home, they built a little kind of hotel, shower place. They would sleep there because they're working 20-hour shifts. Mandatory. Because let's say maybe I have 4 or 5 friends that work on Rikers Island. So I get it all. So they say they can't stop the drugs. They can't do this and that. They're hoping the federal government comes in and takes over. But I don't think they're going to be too happy about it. We had 3 hospitals go in front of the city council and said, we're not going to be able to get this project going for the sick people coming out of Rikers. One of them is Bellevue. They were supposed to be ready now, maybe 24, maybe 25. Woodhull Hospital in North Central Bronx. Oh, we really even haven't started to get going with this project. So in other words, this building is their last shot. They need to get something done before the feds take over Rikers and all their cushy little people that they know are going to be gone. Because I don't think they'll be doing overdoses on Rikers if the feds are running that facility. Thank you.
The next speaker is Grace Marrero, and after that is Albert D'Angelo.
Hi, good evening. Before we start, can we get some heat in here? It's really cold.
Excuse me, did you call my name?
Grace Marrero is the
D'Angelo?
speaker.
Al, unless you're me, no. Okay.
Thank you.
Oh, hold on one second. Okay, so heat. We need some heat in here. I'm going to talk for 2 people. One for myself, but first I'm going to do Gonzalo Duran. He is a little background on him. He is a veteran. He was in Afghanistan. When he came home, he was homeless. And so through his hard work, he created an organization called Devil Dog USA to help support the veterans that were like him and are like him that are homeless. He helps them find homes, jobs, and gets them involved. So this is his statement because he couldn't make it today. Dear hearing committee, I trust this message finds you well. My name is Gonzalo Duran, and I have served as a community advocate for 11 years, specializing in veteran housing while addressing various community concerns. Currently, I hold the position of CEO at Devil Dog USA Incorporated. I am writing to express significant reservations regarding the Just Home project proposed by Jacobi Hospital. Specifically, the plan to house formerly jailed individuals with medical issues is not suitable for our community, especially considering the current time frame. The community has vehemently voiced its opposition to this project, surpassing the intensity of any other issue in recent memory. Each recorded event on this matter has generated a consistently negative response from the community. In my capacity as the CEO of Devil Dog USA Incorporated, my office has experienced a substantial increase in veterans seeking supportive housing. Many of these veterans are grappling with medical issues stemming from their service to our country, particularly those who have been displaced due to the recent increase in migrant influx. Additionally, in my role as the vice chair of the Bronx County Conservative Party, I have engaged in numerous conversations with community leaders and constituents who oppose the Just Home project. Notably, there is not a single member in favor of it, primarily due to the perceived danger it poses to the specific community located near homes, schools, and other family-oriented facilities. While acknowledging the significant need for housing for incarcerated individuals and recognizing the importance of humanitarian efforts, it is crucial that the community's voice is not overlooked. As an individual deeply connected to and actively involved in this community, I believe that while the community is willing to do its fair share in supporting the reintegration of individuals, the proposed project in this specific location and at this point in time is not aligned with their wishes. I appreciate your attention to this matter and would welcome the opportunity to discuss it further at your earliest convenience. Best regards, Gonzalo Duran, CEO, Devil Dog USA Incorporated, Vice Chair, Bronx County Conservative Party. So that was, I still have a little time. So as for myself, I am from this community. I do oppose having formerly incarcerated people. Just a little background. I'm originally, okay, I have a little drama queen. I'm originally from the South Bronx, Fort Apache. I got here when I was a teenager, and it was a beautiful, I've seen the neighborhood change over the years, over the decades. In my family, I have people in law enforcement, and I have people that are criminals. And to be just from personal experience, my family members that are criminals, we don't want them back. We don't want them in our neighborhood. And this is just from a personal standpoint. So a lot of the people that you're proposing to bring here are not even from this community. We don't need them here. They're not going to be rehabilitated. I have firsthand experience with that. And, you know, I'm fighting for my grandchildren, because I read an article that Just Homes was interviewed, and they were asked about whether or not pedophiles would be eligible, and they said, we don't turn away anybody. So that means that there will be pedophiles coming into this area.
Thank you
which
for
we
your
don't need.
comment.
Thank you.
Yeah, thank you very much for your comments. The next speaker is Albert D'Angelo, and after that is Jesse Lang.
Good evening. You've asked for community input. 7/19/2022, the first community meeting at Maestro's about Just Homes initiative called by the Morris Park Community Association. There was standing room only. People expressed their outrage at the proposal. Some of the group were rowdy and angry, but the message was clear: not in our backyard. Some of our elected officials were there. Our city council member, Marjorie Velasquez, released a statement stating she was against the project. 8/7/2022, meeting called by the Housing Committee of Community Board 11 at Jacobi. Again, the community voiced their disagreement with the proposal. Only 5 people spoke in favor of it, and none of those were from the immediate neighborhood. Representatives from the Fortune Society were present. 10/22/2022, a third community meeting regarding Just Homes called by HHC at Jacobi Rotunda. Although parking was not made available for the community, I'm sure by design, a sizable crowd expressed their displeasure with the proposal. 10/27/22, Bronx Community Board 11 voted no to the project. 12/6/2023, HHC Jacobi Community Advisory Board meeting, Jeanette Merrill, Assistant Vice President of Communications and External Affairs for HNY Health and Hospitals Corporation, presented a briefing of Just Homes to the CAB. And again, you heard our displeasure. State Senator Natalie Fernandez, Assembly Member Michael Benedetto, Assemblyman John Zak Caro, Councilwoman Marjorie Velasquez, and Councilwoman-elect Christy Marmorato have all publicly voiced their opposition to the project. The community board, our elected officials, well over 1,000 petitions, and an overwhelming majority of the community are opposed to this project, and yet you still persist. I love Jacobi Medical Center and the work they do for our community, but I love my community more. It seems money talks when it comes to HHC. The community be damned. The community would like to partner with HHC to bring something we could all agree on for our community, something the borough needs. The borough that has the highest crime rate, is the least healthy, the least educated, and has the most homeless shelters and group homes per capita than any other borough. We hope you would bring something which would help put us on a par with the other boroughs. The voters of this community will ask our elected officials to support any project that would benefit our community in the Bronx and withhold support to HHC for any program which it would not. You assure us that there will be no problems, yet you install a security camera system. The recidivism rate for drug crimes is 62.7%, other felonies 74.2%, property crimes 66.4%. You have stated at the web meeting that those who did not follow the rules would be evicted. Since they are giving a lease, it could take you up to a year to remove those people from their residence. You have asked for input from the community. You received it loud and clear. It would be nice to work with you and the community with you and you with the community to find something which would be advantageous to both. Thank you.
Thank you for your comments. The next speaker is Jesse Lang, and the speaker after that is Philip Hall. Jesse Lang. Okay. I'm going to move on to Philip Hall, and the speaker after that is George Havranek. Philip Hall. Okay. Go ahead.
Good evening, everybody. I'm George Havranek from the Spencer State Civic Association, and I'm a proponent of our low-density communities. John Zak Caro and following speakers have basically summed it up very nicely, so I'm not going to regurgitate what they've said. Mr. Richards, I would say this: you should be applauded for your accomplishments. But you, sir, are an exception to the rule. You are basically a lottery winner. The chances of attaining what you did are astronomical, and I applaud you for that. But we can't expect the same outcome. Now, the testimonial evidence you gave was bevied with emotion, wins the hearts. You spoke about love. What about love for the community? What about a community that is being said it doesn't do enough? When is not keeping a nice, stable, clean, safe community not doing your part? That, to me, is doing everything that is being asked of you, that is something to emulate. Emulate, not ruin. Now, I'm not going to bore you with statistics. You really don't want to hear them. But there's something that should be said in the name of safety. All right, we worry about recidivism. That is true. Now, we could look at a study. Now, this is unbiased. Unbiased study. 10 years, longitudinal. Very good sample size. Start date. Start date was 2009, end date December 31st, 2019. Sample size, 409,000 people that were incarcerated. Out of those 409,000 people, they accrued 2.2 million arrests after release from prison. 2.2 million. That's fact. That's DOJ. That's not my numbers I'm making up. Additional breakdowns show 66%, 2/3 of these prisoners released across 24 states, including New York, were arrested within 3 years, rearrested. and a whopping 82% were rearrested within a 10-year period. So to suggest that the rehabilitation is going to be a cure is being disingenuous. I mean, I have family members that they've basically been on both sides of the bars. And no, we don't cast aside the ones that were on the wrong side, but we recognize the flaws. They're human. There are a lot of flaws in humankind. And we have to recognize something. We always hope that successful behaviors and methods will be modeled and replicated for others to follow. However, we have flaws, and the characteristic of humankind suggests we're going to fail most of the time. You cannot ask community stakeholders that have already done their fair share by keeping a nice, safe, clean community to take a gamble on this. This is like playing with Las Vegas casino type style. We have areas of need. Veterans, without a doubt, they are in our hearts, in our minds always. Now we gauge a society on how it takes care of its most vulnerable. Are our elderly among the most vulnerable? Why isn't this space being looked at for our vulnerable senior citizens? It's a travesty that you sit up here and want to be landlords. Landlords that could monetize it to the nth degree because you're going to make more money with the Fortune Society. You're going to make a fortune, but you won't make that fortune with our seniors. And you know that. This is just another case of investor greed before community need. I thank you, and I hope you turn this down.
Thanks for your comments. The next speaker is Rita Zullo, and after that, Kendra Clark. Rita Zullo. Rita Zullo or Kendra Clark. Okay. Go ahead.
Hello, everyone. My name is Rita. I represent the Allenton Avenue Homeowners and Tenants Association. There's not much more I can say. Everybody's said it all, but I'm going to go ahead and read what I wrote. Today, I'm sharing my opinion and concerns about the proposed Just Homes project to house the formerly incarcerated. There are several of us in the community who are in opposition of this project. We would also like to propose alternatives to this location. We as a community have been told that the eligible clients will be homeless and formerly incarcerated or pretrial detainees from Rikers Island. And as the Fortune Society stated, they will have complex medical needs. Many of you will agree that there are many questions here for which we need answers. For one, what were these individuals serving time for? Do the reasons for incarceration for any of those who will be residing in the building consist of high-level crimes such as murder or sexual assault? Additionally, are any of the former criminals listed as sexual offenders, pedophiles, or predators? Will these individuals be able to come and go from the facility as they please? Their crime makes a difference if they are to be mobile and come and go within our community. They say they have medically complex issues like stage 4 cancer and end-stage renal disease, as well as congestive heart failure. 2 out of the 3 are considered terminal illnesses. However, we've heard conflicting statements on the complexity of their medical conditions. We want clarity on exactly what diagnoses these individuals are being treated for, or if they're going to reside here. I am sure what is in question here gives all of us in opposition to the project the right to be concerned. I understand the city stands to make money on this proposal, but at what cost to our community? We feel one of the alternatives to the location for the Just Homes project could be Lincoln Hospital. There is also the potential option for New York City Health and Hospitals North Central Bronx. These locations are not in residential communities. We have to consider that the current proposal puts these individuals amongst single-family residences and schools, which has the potential for putting the community at risk. Without specified knowledge of these prior points, how are we to know that these individuals not commit crimes in our community? The lack of transparency in this project is what is letting our imaginations get the best of us. This is a diverse community built of hardworking and caring individuals. Many of them donate their time to serve our community in one way or another, whether it be through coaching Little League, organizing parades, or leading community organizations. We are the people for the people. We welcome change that is beneficial. We would argue that the Just Homes project is not beneficial, at least not for this community. This space could fit many needs, like affordable housing for our well-deserving veterans, or affordable housing for our seniors who can't afford the rising cost of living. This space should instead be used for many of those who have served their country and their community. Thank you for allowing me the time to express myself here today.
Thank you for your comments. Next speaker is Andrea Clark. Okay. Speaker after that is Brian Shaw, and after that is Asia Thomas. Brian Shaw. Asia Thomas. Okay. Next speaker is Cassandra Warney, and after that is Scott Blumenthal. Go ahead.
Good evening. I'm Cassandra Warney, a senior program manager at Corporation for Supportive Housing, and I'm testifying in support of the Just Home project. CSH is a nonprofit intermediary and community development financial institution focused on advancing affordable housing with services to help people and communities thrive. We are committed to sustaining and increasing access to permanent and affordable housing solutions, especially for people who face complex barriers, like those involved in the homeless, criminal, legal, and emergency health systems. We have a 30-plus year track record of innovation and investment in New York City by partnering with affordable housing developers, hospitals, city agencies, and other nonprofits to make having a home a reality for those facing the barriers I mentioned. Investment in supportive housing is an important public safety strategy backed by research, and CSH is coordinating a sign-on letter in support of this project. In case anyone would like to add their name or organization, please let me know. We know there are well over 2,500 people in city jails that could greatly benefit from supportive housing. This is based on an analysis and policy report that my team published on Rikers and supportive housing in 2022. Currently, there are only 120 units of supportive housing dedicated for people leaving Rikers. In New York City's Department of Health, Mental Hygiene's Justice-Involved Supportive Housing, JISH, and clearly 120 units is not enough to meet the need of over 2,500. Black and brown people are disproportionately impacted by the homeless and criminal legal systems. And the tragic irony of the justice system is that once someone has paid their debt to society and we expect them to rebuild their lives, we then tell them, you can't live here. We also know as New Yorkers, there's an acute shortage of affordable housing that every neighborhood faces. Just Home is an important project that adds the affordable and supportive housing units we so desperately need and addresses inequities. This project represents a chance to add 24 units of affordable housing. The additional 58 supportive housing units will be designed for tenants who have chronic illnesses such as congestive heart failure, stage 4 cancer, end-stage renal disease, oxygen dependence, or needing help with activities of daily living. These 58 units represent permanent, affordable housing for people with complex health needs, an important alternative to this city's shelter system. I'll end my remarks by uplifting the incredible work of the Fortune Society, and this neighborhood would benefit in having them as a partner in your community. The Fortune Society is well respected for its over 20-year commitment to building reentry housing and being a great neighbor, perhaps most well known for the Castle Gardens in West Harlem that Deputy CEO Stanley Richards mentioned. I can personally attest to their housing and being a good neighbor. I lived at 137th and Riverside for 6 years, 3 blocks down from the castle. I often walked by the entrance on Riverside and didn't even know it was the castle or reentry housing until a few years into being in the neighborhood when I learned about the castle on a work webinar. This is how well their reentry housing becomes part of the community. Not only does this project give members of our society dignity as they live with complicated health needs, it also gives this community a strong resource in Fortune Society staff. What is great about projects like Just Home is there are strong services and staff to help tenants, whether it be in the supportive or affordable housing units. There are dedicated professionals to respond and work to resolve, a resource many private market and general affordable housing projects don't offer. Affordable housing investment is critical for public safety, and research shows this. Just this fall, Columbia University released research findings that look at using supportive housing as a reentry investment over a 10-year window. And the findings focus on people who left Rikers shows it works. People stay housed. They're significantly less likely to have future encounters with emergency rooms, shelters, and jails. So we urge the New York City Health and Hospital Board of Hospitals to approve the ground lease of the project so that Just Home affordable and supportive housing project can move forward. It's important to support our most vulnerable neighbors, especially those who've experienced incarceration, and invest in affordable housing for public safety and strong communities. Thank you.
Thanks for your comments. The next speaker is Scott Blumenthal. And after that is Kenneth Edwards.
Hi, good evening, everyone. My name is Scott Blumenthal. I'm actually here tonight as a representative of the Interfaith Center of New York. Our executive director, Reverend Chloe Breyer, hoped to speak to you tonight, but unfortunately was called away on a family medical emergency. So I'll just tell you a tiny bit about the Interfaith Center and the reason that we're supporting the Just Home project. And then I'd just like to add a couple of brief thoughts of my own. The Interfaith Center for 26 years has strengthened New York City's civic fabric by building bridges between diverse faith traditions and by offering civics training for grassroots and immigrant religious leaders. Founded in 1997, ICNY has grown over time to become a nationally recognized nonprofit organization that catalyzes partnerships among grassroots and immigrant religious leaders and civic officials to address New York's most pressing social problems. Over the years, these shared concerns of New York faith leaders have included housing, immigration, and prison reentry. ICNY has also conducted religious diversity trainings for teachers, lawyers, and hundreds of equity and inclusion officers at the NYPD. On a more personal note, I will acknowledge that I'm not a resident of this community, but I have lived in Washington Heights for the last 20 years, and I've raised 2 children there. And I understand how it feels to worry for the safety of your children in this city. I'm also a volunteer interfaith chaplain on Rikers Island, and I've been a member of a Quaker worship group at Sing Sing Prison since 2016. I've gotten to know many detained, incarcerated, and formerly incarcerated people, some very well. I've had the pleasure of staying in touch with several men as they readjust to life in New York City after finally leaving prison. It's a joyous but a difficult process for all of them. And I can tell you that the Fortune Society has provided invaluable assistance and stability for everyone who sought it out. Many lived in their supportive housing at the Castle and Castle Gardens. Not one of them has reoffended or returned to jail or prison. They're working, reintegrating into their families, and very often volunteering to make their communities safer. I've gladly welcomed these men into my home and introduced them to my own children. I've heard many of you tonight speak out on behalf of other vulnerable members of your community, and I'm moved by these pleas, and I pray that these people also get the support they clearly need. But I do hope that you will choose to welcome and get to know the future residents of Just Home as neighbors. Thank you.
Thanks for your comments. Next speaker is Kenneth Edwards, and after that, Patricia Haversham Brown. Kenneth Edwards. Okay, Patricia Haversham Brown, and after that is Josh Goodman.
Good evening. I thank you for having me here and allowing me to speak in behalf of the Just Home project. I am so in favor of it for many, many reasons. I am the Director of Cases Intense Mobile Treatment Program. We work closely with Fortune Society, have some of our clients in some of their residences receiving the supportive services that are assisting them in their readjustment into the community. I often think about the clients that we have coming home from Rikers Island, the elderly with serious health conditions. And the only place they can go is to the shelter system because at this time there is no housing available for them. I urge some of you, take a trip, visit one of the shelters, take a look and see what it's like for people to have to stay there. And then I would ask you to visit some of the emergency rooms, the overcrowding that's there. That's all our clients have when their health issues present themselves, in and out of the emergency room, cycling. The Just Home Project would prevent that and assist our clients with housing. You heard Mr. Richards mention the Academy on 140th and Riverside. I can remember when the community board did not want that building there. And I remember the days that they welcomed their families to come to the Academy for our Halloween parties so that we could scare their children. It's a process, but think about the fact that I understand your feelings, I understand your thoughts, but how many of us sitting here have family members or friends who have been incarcerated? Wouldn't we want the best for them also? Wouldn't we want them to make the best out of their lives as opposed to sitting in a shelter system with no housing? I am so in favor of the Just Home Project, and I truly hope that we think about reconsidering and go for this. This is just awesome. I don't see where it would be a negative thing in the community at all. Thank you so much.
Thanks for your comments. Next speaker is Josh Goodman, and after that, Dominique of the Peters family. Dominique Peters. Josh Goodman first. Dominique of the Peters family. Okay. Next speaker after that is Gina Caliendo, and after that, Robert Press.
My name's Gina Caliendo, and I'm a 50-year-plus resident of Indian Village. First, I want to thank you so much for moving this meeting to 4 p.m. and providing no parking. It prevented many of my neighbors from being able to attend. I'd also like to thank you for the added security of the metal detectors and police detail. I guess you felt you needed protection against our community residents who are, by and large, law-abiding, non-violent individuals. Pretty ironic. Pretty ironic. So I know firsthand that despite Jacobi's terrible quality scores, you provide kind and compassionate care, and your staff is wonderful. But your staff deserves better than this. Jacobi was never a good neighbor for us, but we accept the 24/7 ambulances, the helicopters, the occasional news crews, because we know it serves the greater good, and we care about our first responders and community members who suffer injuries and accidents. Our biggest issues have historically been parking, trash, random patients leaving bloody bandages on our steps, police chasing escaped prisoners from the ED through our backyards. But we've had years of broken promises. Still waiting on the parking, still waiting for that wall to be fixed, Mr. Doyle. So it's really no surprise that this project has been lie after lie after lie. Began as housing for released individuals with serious medical conditions. At death's door was how it was described. Now it's morphed into medically complex pretrial detainees, a very, very different population. And we all know what it takes to get a bail for an offense these days. At each meeting, I've raised questions that shouldn't be hard to answer, yet not one was answered with actual data. We were promised answers to our questions over the summer in 10 days. But over a month later, we got cherry-picked partial answers, not one of which addressed key questions about the effectiveness of their programs. Tonight, we heard wonderful anecdotal stories of individual outcomes. But as scientists, we all know that anecdotes are not evidence. The only evidence that exists is the 2008 study that found that Fortune Society's programs were no better than nothing. We hold teachers and principals accountable for performance. Hospitals are accountable for health outcomes. Why are we not doing that with an organization that gets over $130 million of our tax dollars? No data, no dollars, no improvement, no new programs. We heard from people who do not live here or who are employed by similar agencies speak in support of this program. It's really easy to support something when you're being paid to do so and will not suffer the consequences and not have to live with the outcomes. Think of the staff of this hospital. Think of the young nurse leaving work alone at midnight, the kitchen worker coming in alone at 5 a.m. Who will help them if one of the residents assaults them? They certainly won't have the security you provided for yourselves. Have any of you spoken to your rank and file, honestly and openly? We have. They are terrified of this project, but also terrified to speak out honestly because they fear retribution from the administration. And that speaks volumes in a very bad way. We already struggle to find nurses and healthcare providers. Why would you make it that much harder? You don't pay as much as private organizations. Why would you make it so much harder for you to recruit new employees? They're going to come here for less money to risk life and limb walking to work or leaving work? That's just insane. So for those of you who say that the individuals here would pose no risk, let me tell you about Ms. Joyce Grayson. Ms. Grayson's a home care nurse, or should I say was a home care nurse in Connecticut. Just last month, she went to the home of a released individual who's medically complex to provide him care. When her family didn't hear from her, they called the police with her last known location. Miss Grayson was found murdered in the home of that individual who was still under some degree of supervision, which would be more than we'd be getting. Which one of you will defend this project when one of those residents murders one of your nurses or one of our family members? You heard our current Assemblyman and Councilwoman-elect speak against this project. Our current Councilwoman, our current state senator have all voiced their opposition, and our community board has voted against it. Why are we even here when no one is in favor for this except for you folks who are bureaucrats far removed from the impact? If you truly believe it's without risk, put it across the street from your mom. Put it where these individuals can look into your parents' backyard and follow their comings and goings so that they're an easy target. Put your office over here. Go to work at the same time as your staff. Then you could see how you will vote.
Thank you for your comments. Appreciate it. Next speaker is Robert Press, and after that, Kevin DeLoya.
Thank you. I am Robert Press.
Hi, Robert.
And enough of the Fortune Society or HHC ringers. And thank you, Dr. Katz, for looking up and listening to me, because you know that I'll tell Mayor Adams about what you were doing all this time looking at your phone. Now, you say residents of Just Home may have mental health and or substance use needs, but they will be referred by CHS based primarily on their medical conditions and needs and will be screened by Fortune. More than double the incarcerated people in Rikers missed medical appointments, and there is no figure for those who refuse to take their medications. You say based on recent data among GCCS patients, 76% have at least one significant health diagnosis: recent/active pulmonary-related lung cancer, heart-related diabetes, and compromised immune systems. 50% identified as homeless, including 10% who came from the Bronx. So why is CHS telling us that these may be regular people like those in the city who have the same problems and are not on their deathbed, since they will be free to go out in the community and even ride mass transit? As for 10% Bronx homeless, the use of North Central Bronx Hospital should cover that. A new $30 million health center HHC is leasing in Far Rockaway, Queens, which is being built from the ground level up. But HHC is trying to retrofit a building that can be put to better use for residents of the Bronx. As always, the Bronx is getting the short end of the stick, since there is no part of CHS programs in any Queens HHC building. You say about 86% of the people incarcerated on Rikers Island are detainees pre-trial, meaning that they have not been convicted. It also means that they have not been proven innocent because they have not had their day in court. It has been said that the justice system needs to be improved to clear out the backlog of the cases. The other 14%, however, are waiting to go to prisons and have been convicted of crimes. You say that every year there are more than 50 people with significant medical needs who need a home treatment after their release from Rikers. The entire campus also is zoned for residential development, including by Building 2, is said in previous handouts. Does that mean there will be 50 more people every year from Rikers or the borough jails? And does it mean that more buildings will be built? As you have said, Dr. Katz, you don't like parking lots, you like buildings. What you are trying to do here in Community Board 11 is have a group home, which comes under the Padovan law, and the state has already said Community Board 11 is oversaturated with group homes, and the state has denied an application early in the year for a group home in Community Board 11. I will now quote from the New York City Controller's monthly data on Department of Correction operations from November 21st, 2023. It shows that as of November 1st, the number of people housed in DOC jails was 6,162, a decrease of 10 from the previous month. However, the borough jails will only hold 3,900 people. People admitted to jail increased to 1,847 in October, with 39 more people admitted than in September. Incarcerated people missed medical appointments 13,610 times in September. Violence indicators mostly increased in October. Assaults on staff increased from 56 up to 66 in September. Fights increased to 447. Slashings increased. It just keeps going on. It also says that HHC did not publish statistics on people with serious mental illness this month. The most recent data was September of 2023, where 1,700 people with serious mental illness were detained on Rikers, which is 20% of the population. Now, we have at North Central Bronx is going to be one of these therapeutic housing units with 120 beds, also for people at Rikers Island with medical problems. However, those people will have Department of Corrections staff watching over them. And it's interesting to note that Christopher Mastermano is the CEO of both New York City Health and Hospitals North Central Bronx and New York City Health and Hospitals Jacobi Hospital. I wonder if it's a coincidence that he is both the running both hospitals, where you'll have staff, Department of Corrections staff, and here where you'll have people all from Rikers Island be able to go free and out into the community. By the way, have you done a risk assessment like the woman before me just said, in case something happens? Should one of your people here at, I almost called this Rikers, at Just Home hurt someone in the community? Thank you.
Thanks for your comments. The next speaker is Kevin DeLoya, and after that, Simon Yale. Kevin DeLoya. Simon Yale. And after that is Patricia Cambria.
Yes, good evening. HHC administration, gallery speakers, featured guests, members of the community, and law enforcement. I just had maybe one idea about all of this. I don't know how feasible it would be, but we do have a state psychiatric facility on Eastchester Road, Bronx Psychiatric. I don't know what their capabilities are. I personally have gone there seeking out services. They have New York State court personnel. I'm not saying that's maybe the best fit for people who are sick, but if they could possibly become violent, maybe it would be a better fit. They certainly have a lot of space, grounds for people to walk, maybe a little bit better than Jacobi. And there are probably better uses for Jacobi anyway. I don't necessarily think that housing for seniors or veterans would be best because, you know, being at a hospital has a very institutional kind of feel. So I don't know about seniors in terms of housing. I understand a number of the NYCHs, for example, the senior residences are possibly being put up for sale in part. I think the Nostrum houses in Brooklyn, and that's sort of like the connection, I guess, to real estate, maybe the concern. And in terms of veterans, I myself have family who have served and actually have died in combat. I know it's terrible. The Walter Reed Hospital needs more funding. And the VA hospital here, the James Peters, I don't know if they have capabilities to house veterans. But that's really where we are. And in terms of hospital employees, I mean, in terms of being like a good neighbor or a good employer, better employer, I should say, I don't know, with this time of year and things being so rough economically, does the hospital have any plan to have maybe a hospital breakfast or lunch for their employees? I know some people spoke about from Neisner last time. I myself am a former delegate for 1199, and there are going to be challenges possibly with the economy in 2024, and just making sure that the Job Security Fund and the Training and Upgrading Fund for the 1199 unit, bargaining unit is maintained. And have a happy and safe holiday season, Hanukkah and Christmas and other holidays, and have a good evening.
Thank you for your comments. Next speaker is Patricia Cambria, and after that, Rochelle Mandina.
Good afternoon. My name is Pat Cambria, and I've been living in this community for 59 years. I was born and raised here, and so were my children. I come here today to express how I feel about the plans for Building 2 on the Jacobi Hospital campus. I am not happy with what Fortune Society and HHC want to do with the property. For anyone attending this meeting that does not know, Building 2 will become Just Home, an experimental housing project for prisoners that are in Rikers Island or offenders scheduled to be incarcerated there. Crimes committed by these inmates and detainees vary from violent offenses that may or may not be gang-related. These convictions include possessions of weapons, stabbings, sexual assaults on adults and children, robbery, property offenses, and drug-related offenses. We are a diverse community of hardworking individuals that care about our families, the elderly, the children, and the area we live in. Our community has at least 16 schools, early childhood learning centers, after-school programs, daycare facilities, programs in the Bronx House, and libraries, all within a mile radius of this project. Why would you jeopardize our children's safety and our quality of life by putting Fortune clients that have long criminal records in any residential area? Furthermore, where was it ever initially announced or posted to the community about our proposal for this project in a public meeting? Where were our voices in all of this? Nothing about this proposal was ever mentioned to us in the beginning. HHC and the Fortune Society and some of our government officials kept it from us. The only reason why we found out about this was because it was leaked out to the community. Also, why is today's public meeting being held at 4 p.m. while people are still working? Isn't a public meeting supposed to be held at a time when all community members can attend and hear all the things that are going on for themselves? Was this done purposely? During one of the HHC meetings in the summer, some of the members of our community and some of the elected officials came up with alternative choices for Building 2. Were our voices heard? And as were mentioned, we asked for low-income housing for seniors, our veterans, a battered women's shelter, housing for hospital staff, daycare for hospital workers' children, a community center, and even a trade school for health services. Were any of these alternatives taken into consideration? We were honored by our Bronx Borough President, Vanessa Gibson, at our last community board meeting. Ms. Gibson spoke about the needs for this community. She said that there is a great need for a blood center in the Bronx. This borough does not have a blood center at all. Why is that? If there was a life or death situation, how long would a person have to wait to get blood? Jacobi Hospital is known to be a trauma center. Why isn't there a blood center next to this trauma center? Ms. Gibson also said that a birthing center is needed because of the high rates in maternal mortality in this community. Birthing centers are inexpensive compared to hospital visits, and they provide another safe alternative for expecting mothers to come for checkups all the way to birth. Having a birthing center would save lives and improve lives significantly. Why not put both of these in Building 2? If our Bronx Borough president sees this as a need for our community, why are we still discussing this Just Home initiative for Building 2? I'm asking the hospital board to hear our voices, the voices of our Bronx Borough president, and the voices of our other elected officials about what is needed in this community that can be put in Building 2. Thank you.
Thank you for your comments. The next speaker is Rochelle Mandina, and after that is Janine Timpone.
My house is 95 years old. Do you know how many families have lived in my almost 100-year-old house? 2. Do you know why that is? Because we, the people that live here, love our neighborhood. How many places do you know of where people stay for generations and manage to keep their neighborhood intact? I'm now going to personalize this because this is very personal. When we choose to stay in Mars Park or Indian Village in the Bronx, it was because of something that you may not understand. We are part of a community that sticks together. Our choice to stay here is because we love where we live, our neighbors, the friends we have made, our houses. Don't arrogantly think it doesn't matter because the Bronx is a terrible place anyway. We have created lives for ourselves, for our children, invested our money and paid our taxes. This is our neighborhood, and all of you who have chosen to live somewhere else have decided that you know what's better for us. What is this really all about? The government sometimes forgets they work for the people. They have groups like HHC do their bidding in exchange for what? Money, power, favors. I'm sure you all know who Bernie Madoff is. He took what was not his and only cared to benefit himself. If you vote for this, you will all be the Bernie Madoffs of Mars Park. You will damage lives of people that have busted their butts to stay in New York City, yet live in a nice, quiet community, a place that helps give New York its character. If you pass this, you will be complicit in the destruction of a great neighborhood full of some of the best people I know. And if, God forbid, one person gets hurt, a nurse leaving her shift at midnight and walking to her car alone, a child going home from school, being that there are a minimum of 16 schools within a mile of this proposed building, or a senior citizen walking slowly with their little wagon full of groceries, it will be on your hands. If you look deep in your hearts, you know 100% this neighborhood is not the type of place that Just Home belongs. There's absolutely no good reason for any of you to want this on Jacobi's property except for the money, power, and favors you will receive. Fortune Society has gotten away without having to provide any extensive factual data. Don't you think if they had numbers to back them up, they would be advertising it all over the country, never mind in New York? A report from October 2022 from the Department of Justice, that's the Federal Department of Justice, says that Just Home clients had long criminal records with little education, ability to care for themselves, and less than half of the clients' participation in the programs that they were more likely to reoffend than non-clients. Maybe you're patting yourself on the back on voting for this. But where is your sacrifice? How is this affecting your family, your homes, your mothers and fathers and your children? The safety of your community. It's easy to be generous with other people's lives and money. Are any of you building any on Long Island or wherever some of you live? I'm wondering why there are so many speakers in favor that are not from this community and will not be impacted. Just one more point. I had to leave work 3 hours early to be here because you chose to do this during work hours during a Jewish holiday. I cut hair for a living, and if I don't work, I don't get paid. I ask you to please hear what we are saying. My house has a lot to do with how I will live when I retire. Our way of living is at stake, and it's in your hands. And I personally would love to see the senior citizens or veterans in that building, since they are the ones that have truly paid their debt to society.
Thanks for your comments. The next speaker is Janine Timpone, and after that, Roy Mandina.
Good evening, all. For those that don't know me already, I'm Janine from Pelham Gardens, the one that has
written to many of you, the one that has tried to share my concern for this Just Home project in my community. Born and raised in this area for 39 plus forever years. I have watched the area slowly change. I'm not just talking people, I'm seeing businesses, infrastructure, housing, and ways of everyday life. Having raised a family through it all, I have been involved in many things, as you know. Being part of this community and many doings, I find it quite disturbing and heartbreaking that we, the people, have come together to respectfully voice our concerns to the board several times now, and this is still going on. New York City Health and Hospitals is the largest municipal healthcare system. The hospital's mission is to be a fully integrated health system to New Yorkers to live their healthiest lives. I understand your corporate strategies that you are trying to establish: integrity, compassion, accountability, respect, and excellence to all without exception. We, the community, are not telling you anything unjust. We are saying this is not the proper program for Jacobi. We, including our senator, assemblyman, council, city council, both current and incoming, are not for this project here. Many other visions for this growing trauma hospital have been proposed by the people that live and work here. So if you once again take a heartfelt listen, we are the ones looking out for the better of the people that live and work in the community confines. We are the ones looking and needing to live our healthiest lives right here in the Bronx near Jacobi Hospital. Jacobi is the Pelham Parkway and Bronx Community Municipal Hospital that we, the people of this area, would like to live our healthiest lives using. And by you listening and understanding and respecting our needs of this community should be part of that mission. Thank you for your time once again, and I do look forward to hearing that something much more better will be coming to our hospital in the near future.
Thank you. The next speaker is Roy Mandina, and after that, Patty Marinello.
Good evening. To start with, I really wish everybody would stop with this formerly incarcerated stuff, okay? It's just watering things down. These are ex-convicts that we're talking about. We're talking about prisoners, okay? Stop sugarcoating this. It's a bunch of nonsense. I want to say, if the president or the upper echelon of the Fortune Society lived on Seminole Avenue, we wouldn't be here. This wouldn't be an issue because none of them would vote for it. You know why? Because they know what the recidivism rate is in New York. I have it right here, okay? This is from the Community Service Society of New York. More than 50% are back inside within 3 years, putting New York among the states with the highest recidivism rates in the nation. Okay, the United States has a current recidivism rate, nationally, 70% within 5 years. You know what that means? It means the 70 prisoners that they're talking about putting over at Jacobi Hospital, 49 of them are going to recommit. They're going to be put back into the system. What does that mean? It means none of us are safe over there. And nobody outside of this area should be voting yes on this. It just ain't right. Now, the gentleman over here from the Fortune Society, he spoke really eloquently, with passion, and I got to admit, he told you the truth. He was speaking the truth. No part of it was a lie. I agree with everything that he said. But he's a smooth talker, but he's still deceptive, and I'll tell you how. He stayed quiet about all the atrocities connected with the Fortune Society when they place people in these kind of situations. He left that all out. Okay, it's all smoke and mirrors when you only mention the 30% that don't go back into the system. He's concentrating and making everyone concentrate on the 30%, and he's forgetting about the 70% that are going to commit crimes again. Now listen, I could pull the same kind of stuff. I could do the same smoke and mirror trick. Here you go. How would you like to have this guy as your neighbor? He fought for his country. He received the Iron Cross. He wrote a bestseller book. He was an animal lover, became an artist. He became a politician. And he was the first politician to make the national environment protection laws. His name was Adolf Hitler. Okay? You like him living next to you? If you leave out the part about him killing 7 million Jews in the concentration camps, he sounds like a wonderful guy. And that's what the Fortune Society is doing. They're making you forget about all the atrocities. Okay? That's what this Fortune Society is all about. I want to go off on a tangent here. I'll finish it under the 5 minutes.
Neighborhood. Are they the same? When we challenge these changes and safety concerns, we are told by Fortune that we should trust them and they have a proven track record of success and safety. As often said by President Reagan, trust but verify. I can stand up here and say that I'm 100 pounds. Unless you see me get on that scale, many would question that statement. This is a community has continuously asked for data to support Fortune's claims of proven success. Yet every request has gone unanswered. Their government funding, just from the New York City Mayor's Office of Criminal Justice, has increased 38% annually. That's 190% total over the past 5 years, while police, school, and library budgets have been slashed. Surely they have to provide the city with details of success to get such an increase in funding. Our requests under the Freedom of Information Act have been met with more stonewalling and delays. Does this data exist? Does it exist and they don't want us to see it? If not, how will they garnish such budget increases in a fiscally challenging environment? The lack of transparency makes one question whether this is fiscal mismanagement or political backscratching. But as I stated earlier, we are not a heartless community. We know that they they are those in need, and that they could use our support and assistance. We as a community are open to ways that we can help support those in need. But instead, we are talking about an organization without a proven track record discussing a facility populated with an ever-changing clientele. We cannot support a project that endangers our children and elderly. My ask that when you are casting your vote for this project, please think about the children walking home from school, the elderly who are often helpless and alone all day, and please think about the hospital staff walking to their car alone in the evening shift. Think about your conscience and how you would feel if this project goes through and God forbid something terrible happens, knowing you are aware of these risks and did nothing to prevent it. Also, please consider that there have been several public meetings with recorded testimony. If something unfortunate happens, all of this testimony will be used as a type of litigation and evidence against New York H&H and Jacobi. Think of the liability you and the city are taking on knowing of these consequences. Please imagine that these are your family members and ask yourself if you could in good conscience support a project that has no guardrails to protect them in any way. Thank you for your time.
Thank you. The next speaker is Phyllis Nastasio, and after that, Renata Rafi.
Good evening. Just first, I want to address Simon. I did bring up Bronx State to Jeanette Merrill. Her response was, then the funding would go to the state and not the city. So yes, this is all about money, because you're right, Bronx State would be a better place to house them, because we know that in Rikers, we don't have medically complex inmates. They have mental health issues. So where would be the better place to house them? In a mental health facility or in the backyard of residents? It's ridiculous. And to Mr. Richards, Barbara and her daughter are great, but you're not putting Barbara and her daughter in this complex. You're taking men from Rikers Island and putting them in this complex. The letter from CB9 was wonderful, but what you failed to mention was the building you took over in CB9 was a drug den that you knocked all the drug addicts out of and all the drug dealers. So yes, they were grateful for getting the drugs out of their community. And just last, you're not taking people from shelters and putting them in permanent housing. You're taking them from Rikers Island. These are men that have committed crimes, and you're putting them in our backyards. And I just lost my train of thought. They don't belong here. There's going to be no security. One person at a desk is not security. So you really need to consider what you're putting on Jacobi's property.
Thank you. The next speaker is Renata Rafi, and after that, Nydia Kunik.
I want to take the time to wish everyone happy Hanukkah, which derives from the Hebrew verb to dedicate. I and many other residents have dedicated over a year towards investigating this project. Never once was any one of us ever asked to participate in discussions or was informed about this project. Residents learned about this project through a leak. For months, the residents have asked the same questions. What type of people will be living next to us? And the story is forever evolving, with no clear understanding to who these individuals will. First, it was stated that they will be bedridden, seriously medical problems, and end of stage 4 cancer. I have reviewed the response from the last Q and answer from HHC. Your response was, the patients CHS refers to Just Homes will be medically complex individuals who are likely housed in the infirmary on Rikers Island. And it goes on to give some breakdowns. In the response, likely is not the definition as to what type of people would be admitted to the Just Homes project. If you wanted the community's input, you would have allowed the community to set up a board to review who is coming in and have some checks and balances, as opposed to CH and Fortune Society having full reign on who comes in, with no knowledge of crimes that the people may have or are accused of. What makes this project even more concerning is that people who are in New York City Housing Authority, NYCHA, they have to go through a criminal investigation background check, along with the applicants who live there, temporary people who are visiting the apartments, family members who wish to join. For people with recent criminal histories or convictions, they will not and probably will not be able to enter New York Housing Authority. How is this different from our community? As a member of this community for over 40 years, this area is in desperate need of elderly and veteran housing. Every day, our elected officials are met with residents who live in this community all their lives and how they cannot afford the rents. A veteran housing center will receive federal, state, and local funding, whereas Just Homes receives state funding. Why are we not addressing the needs of our community first? The people who lived and worked here in this building. Currently, there are about 10 to 20 public schools, all located less than a mile away from this project. Who will be protecting our children? One school is located right outside the hospital grounds. Putting a project like this right in the middle of a residential area with no thought-out process is carelessness. We have Waters Place located a few blocks away that is more prepared and better suited for this project. Waters Place offers access to food, medical, gym, transportation, and an education of Mercy College that's on that campus. All of these services are located within walking distance of their campus. This location is more suitable for this area. Why wasn't it taken into consideration? Because it is not financially beneficial for Jacobi? As a parent of 2 young children and a member of this community, we are worried about the safety of our community and children.
Thanks for your comments. The next speaker is Nydia Kunik, and after that, Debbie Kowalik. Nydia Kunik. Debbie Kowalik. Next speaker is Hawa Yoda Zaibeda. Sorry if I pronounced that wrong. Okay. Lisa Di Tomaso. And after that, Michael Kess.
Okay. Want to start? Okay.
Go ahead.
I have lived in Indian Village for over 50 years and grew up across the street from Building 2. My mother is almost 80 years old and still lives there alone. From the windows of Building 2, you can see directly into her house. These individuals, mostly pretrial detainees, who you want to place there will be able to see the daily patterns of our most vulnerable residents. Out of the 5 homes that directly face the building, 4 are senior citizens. There are research studies published that have stated, quote, associating with other justice-involved individuals can increase the risk of recidivism. This is because such associations can lead to exposure to further criminal activities and negative influences. The Fortune Society came to our meeting last year, and Stanley Richard said to me personally, quote, you don't need to worry. These people will have 1 foot in the grave. Then the story changed to medically complex. Then the story changed yet again to include mental health issues and substance abuse. And found out that there will be no restrictions on who can live there and that there will be no security other than cameras and a front desk person. Fortune Society has no concrete data that states their program is beneficial. I would think that a program that gets millions from the city, especially when the city is cutting education, police, and libraries, would want to prove that they are worth the millions that they have received. What will you do if the city cuts funding to Fortune? They will not be able to pay the rent, and then you will never get those tenants out. Just ask Roderick Compass. The Fortune Society restricts who can live at their 97th Street building because they own that building. You cannot live there if you have a history of methamphetamine production, arson, sex offenders, those who pose a risk of violence, or anyone the Fortune Society deems inappropriate. So, Fortune Society preaches about giving people another chance. Everyone deserves housing, and that it should not matter what these individuals did. I guess that doesn't apply if they own the building, or if one of their administrators at Fortune lives in the area. So, since they pick and choose who they want, I guess that leaves us with everyone else. So let's say Building 2 gets 10 with a history of methamphetamine production, 10 with a history of arson, 10 with a history of sexual offenses against children, 10 with a history of rape, 10 with a history of gang membership. And add in, if you put gang members from rival gangs, you will have battles over who will control the building. According to several correction officers at Rikers, most of the pretrial detainees are members of gangs. Since Fortune Society has restrictions at their building, this is a very real demographic. You made these plans with no concern for the safety of your employees and this community. You did not inform your employees of this plan until the community gave out flyers. We gave out over 100 flyers to your nurses this weekend. Many were shocked because they thought it was stopped. Do you know how many said they support it? 1. Do you know how many in our community said they support this? None. My parents used to tell me that nothing good happens after midnight. What safety measures do you have in place for after midnight when the Fortune Society employees go home? At 3 a.m. when a nurse walks to her car. I hope she is one of the employees who was lucky enough to get a birdie alarm from Jacobi. Your employees are very concerned. They do not want this, but they have told us that it was made very clear that they are not allowed to voice their opposition for fear of retribution. So to all of you sitting up there, would you feel safe with your elderly mother sitting alone across the street from 58 individuals with a history of violent crimes, with no restrictions and no security? Why would you not look at another vulnerable population like veterans? Here is an ad in the Bronx Times Reporter begging landlords to accept veterans into their housing. These individuals may have mental health issues and substance abuse issues, but they've served their country and deserve to be treated with respect and dignity because they earned it. There is minimal housing available for veterans. They need to go to the west side of the Bronx for services. If you choose to give veterans leases, you would get federal, state, and city funding. That sounds a lot more secure than a company that has no research to prove their program works. Please think about the safety of our community and your employees. And remember, the supporters of this program do not live here, but just want housing anywhere and everywhere, no matter what it does to a community. Thank you.
Thank you. The next speaker is Michael Kess, and after that, Charlene Jackson Mendez.
Hi, my name is Michael Cass. I'm a resident here in Morris Park, and I wanted to thank the Health and Hospitals Board and Jacobi Medical for hosting this meeting. I had the privilege of speaking at the Health and Hospitals annual public meeting earlier this year about this topic, and I'm grateful that the process to put this vacant building to use is finally moving forward. After a year and a half since it was announced, it is time for the Health and Hospitals Board to approve Just Home. Just Home is not an experiment, as opponents have called it. The Fortune Society has already demonstrated successful housing programs for the formerly incarcerated. Just Home, however, does address a completely unmet need in the city of New York: quality, permanent housing for the formerly incarcerated who are too sick for DHS shelters that are ill-equipped to meet their medical needs. With this housing crisis, the need for all types of new housing is immense, whether it's housing for young families to affordable housing for seniors. That is especially true in this district, where we've built very little new housing. However, in the case of Just Home, this is a population that is completely unserved by existing housing options. For those who would qualify for Just Home, where they would be steps away from the medical services they need, it could be life-saving. That's why this project is so particularly urgent. This is needed, and we must reject cynical attempts by opponents to pit groups of vulnerable New Yorkers with housing needs against each other. I must note, many of these same opponents who spoke here tonight objected to projects with affordable senior and veteran housing, such as the Bruckner Sites rezoning, not too far from here. It is shameless, and there is no doubt in my mind that if Building 2 didn't already exist, they would be against it for being out of character with the neighborhood. With regards to location at Jacobi, I believe my neighbors can all agree that Jacobi Medical is among the best equipped of all the health and hospital facilities. And there's no, excuse me. And there's no doubt in my mind that this is an initiative that Jacobi is best equipped for. After all, we're talking about folks who are already patients here at Jacobi. They already come here, and Just Home would allow those who are no longer incarcerated to continue their treatment here. I've seen opponents previously claim that Jacobi doesn't have enough amenities to support the tenants of Just Home. Where will they shop? How will they do laundry? Even where will they park? While I appreciate this concern for the tenants, it seems most solutions that opponents come up with involves placing tenants as far away as possible from the very medical services they need that are provided here. It completely misses the point of Just Home. Besides, I'm confident that the Fortune Society and Jacobi Medical will ensure that tenants will have the access to amenities beyond their medical needs. After the conclusion of tonight's hearing, I hope that the board does not hesitate to pass Just Home. It is in the public's interest, and it is in our community's interest. I look forward to the Fortune Society becoming an active partner in our community. Thank you.
Thank you. The next speaker is Charlene Jackson Mendez, and after that, Ed Murphy.
Good evening, members of the Jacobi Hospital Board of Directors and members of the East Bronx community. Before I continue, I just have to say, you all have made me so proud to be a member of this community. I wish that you all could have some empathy for how it feels to work so hard to maintain a home, to love your children and your family, to do all that you can to contribute to your society and to have that threatened. We're a diverse group of people. We love our families and our community fiercely. I would like to state again that I'm coming from a place of deep love and gratitude for my country and my community. I continue to be alarmed by the use of the tactics of racial divisiveness and identity politics to bring about the fundamental transformation of the East Bronx that is deemed by a group of progressive elites to be necessary to bring about social justice. Law-abiding, tax-paying citizens throughout New York City are genuinely suffering at the hands of progressives who are not responsive to the public. We are living through an era where progressive elites, under the guise of social justice, seek to impose their plans for centralized government on a largely apathetic and increasingly illiterate public. The people of the East Bronx have suffered and continue to suffer daily because of progressive policies that were cynically put forward to bring greater justice to Black and brown people, supposedly. Excessive government spending and taxation, bail reform, defunding the police, the liberalization of marijuana laws, shutting down schools unnecessarily during COVID, and the support of illegal immigration have brought our city to its knees. As a mother, I live with the daily fear for my children and grandchildren. We are living the failure of progressive policies that have resulted in increased crime, the proliferation of smoke shops, as well as frequent and public marijuana use by our youth, which daily fouls the air and compromises their healthy development. Abraham Lincoln stated that the United States could only be destroyed from within. Sadly, we are living through the destruction of neighborhoods throughout the East Bronx due to the willingness of many of our elected officials to impose their progressive agenda, no matter the will of the people or the harm that ensues. It is because of the foregoing that we must do everything legally possible to stop the Just Home project from being implemented at Jacobi Hospital. We have seen over and over the danger of implementing policies that require us to suspend common sense and good judgment. First and foremost, the overwhelming majority of individuals that live in Indian Village and the surrounding communities do not support the project. We have a right to self-determination and the ability to be safe in the community that we continuously strive to improve. Assisting criminally justice-involved individuals should never come at the expense of imperiling the lives of those that have done nothing other than work, pay taxes, and abide by the law. We must hold on to every stable community that we can and seek to encourage the same elsewhere. There is no way to negate the risk to the community. Although the prospective clients of Just Home are identified as formerly incarcerated, the term is misleading. They will only be formerly incarcerated because they have been given a residence by Just Home. The community, as well as our elected officials, would have absolutely no way to influence the individuals chosen to participate in Just Home. There is nothing that legally binds the Fortune Society to make sure that individuals participating in their program have not engaged in serious violent crimes such as murder or rape. Additionally, there is no way to ensure that residents of the program have serious debilitating illnesses. Chronic illness could be as simple as uncontrolled diabetes or addiction. Residents of the program are not required to participate in treatment. They are essentially asking that a housing development filled with residents who are by definition at high risk for recidivism
Thank you so much for your
of a
comments. You can
hospital with
submit
vulnerable
your
patients, hospital
papers.
staff, students,
Thank you.
and local
Thank you
residents.
for your comments. You can submit anything additional by bringing it to the box in the lobby or the staff person in the lobby. Next speaker is Ed Murphy, and after that, Efren Gonzalez, please.
Good evening, everybody. I'm a Bronx-born guy from the 60s. Lived in the South Bronx when it was burning. Most of these folks that lived in the South Bronx moved up here. They did not run from the city. They did not run from the Bronx. The Bronx is no longer a dumping ground. I guess you guys are finding that out. We're going to speak. You're not going to shut us down. Okay? You can keep throwing these meetings at us. We're still going to keep coming. We're not against people having the right to live in a home. That's not it. We invested in our area. We've lived in this area. You've heard 50, 60 years. We're not running. We don't want to run. We ran in the years past when the Bronx was burning. The Bronx is becoming a developing ground, and it's the last frontier of the boroughs, okay? Now everybody wants to get in. You cannot recognize the South Bronx any longer, okay? In most of these new buildings going up along the number 2 and 5 line, maybe some of those buildings could accommodate maybe 10 residents at a time, but putting in 70 residents, unproven track record here, I don't think it's gonna work, okay? So I'm totally against Jacobi. Do the right thing. Turn it down. Turn it down. Thank you.
Thank you. Next speaker is Efren Gonzalez. And after that, Robert Carmody.
Good evening. My name is Efren Gonzalez III. I am a veteran, a Gulf War veteran. I'm also a worker at Montefiore. I'm a delegate with 1199. I have been here in this community since 1971. What I want to stress is the things that are not being presented by Fortune Society, and more importantly, health and hospitals who glossed over it without looking at what's deep inside here. This project is going to create a public safety nightmare for a community that does not have the infrastructure to deal with that many formerly incarcerated going up the viaduct here on Morris Park, all the way up to Allerton. Westchester Square is going to be affected, including Drugs Neck. Co-op City will be affected because this area has public transportation that will get you to those areas. It's going to be really hard. But my main concern, and this is something that has been grappling with me, is with all the schools with children, and you're going to put them in a vulnerable state. And they're not just little kids. I'm talking about teenagers. They're growing. They're going to be confronted with problems, especially people that have gang activity. And mark my words, if they cannot handle the gang activity on Rikers Island, Fortune Society, I don't know what fortune cookies they want you to read, but it is not going to happen. There's going to be problems. Yes, people can put the good things, but when you don't tell the bad things, and you see what happens is, I can tell you 60 things that were good, but those 3 or 4 things where, what was that? Well, yeah, a guy got into an argument and he got stabbed. Okay. Another guy followed a woman into her apartment and raped her. Okay. Another guy got shot. Why? Because it was a bad drug deal. Because even though you're in probation or you're in transition, you're still going to see recidivism. And it's going to happen even with people living on New York City health and hospital grounds, which is startling because in 1955, when this great hospital came in, this didn't then become a corporation until 69. But what you have to understand is this real estate deal, it might make you look good. You might have been happy about it. But in the long run, this is going to be the legacy when you see the bad things, because it's going to go back and they're going to say you made a bad deal. Yes, this is a bad deal. The veterans need a support center. I think housing for veterans, I thought Ricardo Garcia's approach was fantastic, and he is a fellow veteran. I also am pleased that, yes, I was supporting the woman who became the new councilwoman-elect, and I'm going to tell you something. I respected her because of her fight for this community, and she listened. Something that I find very hard to believe, that a lot of people in high places, including the mayor, who just really lost it over the migrant crisis and put us in a financial burden. So I really think that people need to step back and reassess. And for the kids, for the seniors, for the common sense good, let's make sure that we don't, screw it up, because we're already in a financial crisis. And this is actually going to cause more problems because they're not going to have enough police here. There are police officers right down the block from your hospital right here that get cases, detectives, when they're off because they don't have enough detectives on duty to handle cases of crime. Do you know how much crime is going to come? Let's go read another fortune cookie. We might just get the truth. Thank you.
Thank you. The next speaker is Robert Carmody, and after that, Michelle Luciano.
Okay, thank you very much. Before me who spoke. You're going to make my speech short because you said it all already, especially the veterans. I don't live in this area. I live in a neighboring community. And I think what's going on is just repulsive. That's about it. I happen to be a real estate broker. I do represent veterans, helping them get homes. I house veterans in my own home and continue to do so. On that note, I think the best thing here, as the previous members of the community, who I applaud, by the way, same thing, seniors, veterans. That's what you guys be doing. What's amazing that I didn't know is I'm an observer. I came here to learn tonight because I'm not educated about the whole situation here. I have to excuse my voice. Basically, what I've seen is, I think like 1, maybe 2, that live in the community that support this. People who own homes here have a right to not want this in their community. They put their lives here, their children's lives, their parents' lives, their friends. First of all, speaking from experience, something like this will devalue your homes. People will move. Even though they say they don't, they will move. The crap hits the fan. Anybody who thinks that's not going to happen is a fool. People from Fortune, appropriately named Fortune, ironically, you're the only ones who benefit from this. Nobody. there has to be something else you can do here. I don't know 100%. I'm not an expert on social services, even though I provide social services for people. I think, again, that people who don't own homes, who work for organizations like yourself that don't live here, have no right at all to even speak here about this. Absolutely not. You're not a homeowner. You don't work here. You don't live here. You should not speak about it. Thank you very much, and good luck to everybody in the village.
Thank you. The next speaker is Michelle Luciano, and after that, Joseph Medea.
Hello, my name is Michelle Luciano, and I just want to thank New York City Health and Hospitals for scheduling this meeting at 4 o'clock on a workday. We all know why that was done. Anyway, I'm here tonight to speak on behalf of my children, parents, neighbors, and friends. I'm a Bronx resident. I've lived in the Bronx for my entire life, and now I'm raising my children here, just 2 blocks away from the proposed Just Home site. As many of you are aware, the first mention of this proposal was met with outrage from this community. It was obviously clear that the community did not want this here, but here we are, almost a year and a half later, still having these discussions. My community is angry, and we have every right to be. We have worked hard to provide for our families and would do anything to keep our children and families safe. Placing a group of ex-convicts literally within steps of people's homes, workplace, and blocks away from schools, and telling us that they have gone through a thorough screening process does not give us any assurance. As much as we want to believe that these people will not reoffend, there are no guarantees. People need to wake up and realize that putting these people here will increase crime in this neighborhood. These individuals have made some really bad decisions in life, and the statistics show that 2/3 of them will likely be rearrested. In addition, 1/3 of the Rikers Island population has a mental health diagnosis. For every 2 mentally ill inmates released, the DOC reports 1 returns in 1 year. These are facts, and we all know that Jacobi is not the correct facility to meet these needs, given the average wait for mental health services is over a year. To those of you sitting up there in support of this project, we know you do not live in this area, nor do you own a home here, or most importantly, none of you are raising your children here. I want you to know that my children ride their bikes and walk our dog past the building every day in the summer. This will directly impact our lives. I will not allow my children to do this anymore, knowing that these people are residing there. And if you are parents, I am sure you would feel the same way. Shame on New York City Health and Hospitals for not listening to this community from the start. This is not the place for this. Place these individuals in another facility, not so close to private homes and schools. We hope that you listen closely to what the community is saying and find another alternative that will not put our community at risk. Thank you.
Thank you. The next speaker is Joseph Medea, and after that, Gino Marmorato.
Good evening. I'm Joseph Medea. I live in the community for over 30 years. This community and the immediate surrounding neighborhood reject any project that does not give it a seat at the table where critical decisions are being made about this proposed lease. Cognizant leaders of CB11, the Morris Park Community Association, and the newly elected district council leader, Marmorato, must be given the highest priority in the decision-making process, and their decisions must not be overridden by the zealots in city leadership, the Fortune Society, and developers who seek to cash in on this impending disaster. There are many statements that the New York City Health and Hospitals Corporation made that are either false or simply not credible. They are. The wall on Seminole Avenue will not be altered or torn down to create a separate entrance. This is not guaranteed. The iron fence, not a wall, just north of the wall, can easily be opened and made into that separate entrance that they will want. They will simply claim it is not a wall, but a fence. Fortune tenants will undergo Fortune's rigorous screening process before being accepted. What are the specific criteria and how rigorous will it really be? This will be an inadequate screening at best, which will allow the worst tenants, such as pedophiles, thieves, and mentally ill in the facility, because the city or their delegates never perform such screenings correctly. Residents of CB11 will receive preference for the units. This is doubtful at best. HPD selected the Fortune Society from a list of nonprofit developers. Let us not be fooled. These people are in it to make money, our taxpayer money, while ruining the neighborhood in the process. Next, let us consider the extremely negative impact to Indian Village, Pelham Parkway South, and the Morris Park neighborhood. This project will have the law-abiding residents of these beautiful neighborhoods do not want criminals, inmates, burglars, car thieves, murderers, rapists, and so forth, former and otherwise, in these neighborhoods. The present situation in the neighborhood is intolerable at best. Burglaries, attacks, robberies, auto thefts have skyrocketed. The 409 precinct cannot keep up and have at times become useless. Lawbreakers have the upper hand because law-abiding citizens have no right to defend themselves thanks to the outrageous liberal pro-criminal laws that are now in place. Thus, this proposal will only aggravate the criminal activities and hasten decay in these beautiful neighborhoods. Jacobi Hospital and the Health and Hospital Corporation, who run Jacobi, are not being honest and forthcoming with facts to the surrounding community. The very employees of this hospital are all against this and have said nothing because they fear job loss. This is a total disgrace and will end these once beautiful neighborhoods. Finally, what is wrong with the location for this development? The building is within 1 mile of many elementary schools, some as high as 16 elementary schools, several daycare centers and playgrounds. The tenant population can include pedophiles and mentally ill individuals who by definition create very unsafe environments. There are many elderly neighbors who live alone and who walk to local stores, churches, and pharmacies. Such persons are placed in grave and severe risk of being attacked by such hardened criminal tenants or their visitors who have little to no regard for life or property. The location is where the tenants are to be housed, does not have any nearby supermarkets, and mass transit is not easily accessible. The area already supports Bronx State and large methadone center plus homeless that are housed at various areas in the neighborhood, such as the Old Capri Whitestone Motel. And finally, the 9/11 Memorial for Bronx residents to reflect on the loss of its citizens on that horrible day is located right next to the proposed facility. How safe will it be for any resident to visit the site with these criminals nearby? Not very safe. I strongly urge of the proposed lease by the New York City Health and Hospitals to the Fortune Society for the development of the Just Home in Building 2 at the New York City Health and Hospitals Jacobi Medical Center. Thank you.
Thank you. The next speaker is Gino Marmorato, and after that, Ryan Aquata. I said that right.
First, I'd like to take this moment to extend the best wishes, love, support, and best of health to a dear friend, coach, and mentor, and one of your fellow board members, Robert Nolan. Thank you for taking the time to join us today as we discuss a matter of great importance to our community, the proposed placement of formerly incarcerated individuals and pretrial detainees at Jacobi Hospital, located right in the heart of our residential area. As someone who was born, raised, and currently lives in Indian Village, I have a strong understanding of what our community is about and what the needs and concerns are of our members. However, as a practicing attorney and former judicial candidate, I find it necessary to listen, analyze, and assess all of the evidence and arguments made by both sides before reaching a well-founded conclusion. Therefore, I truly appreciate listening to both advocates for the proposed initiative and those that have opposed the project. It's telling, though, that those that spoke in support of the project or members of organizations that do not live in the community. It's telling that those that oppose the projects live directly in the community and will be affected on a daily basis. Since this is live recorded, I'd just like to take a polling of the room, and how many of you that spoke in support of this project live within 1 mile radius of this? In support of this project, live within a 1 mile radius. Okay, we'll count you as a half. So I see 1.5. Okay, now I'd like to take a poll. How many of those of you that spoke against this project live in the district, in this community? I could count, there's a lot of hands for those of you that are watching at home. At least 20, 30, 40, 50, maybe more. Listen, it's undisputed that it's essential to promote rehabilitation and integration for individuals who have served their sentence. It is the foundation of our legal system and our values as a country. However, we must balance this need with the safety and well-being of our community, especially our children. Placing individuals with a history of criminal behavior in a facility so close to where our children are educated and play raises concerns that have not been addressed sufficiently by any impact studies whatsoever. Escalating recidivism rates and failed legislative policies, such as bail reform, also cannot be ignored. While few have inadequately thrown around the term fear-mongering, stating facts and raising concerns is acting rational and being pragmatic. Courts often weigh the balance of evidence, and herein the proposed harm of such a project to many substantially outweighs the benefits for such few. What's most concerning about this project is that many lack faith in the organizations involved in it. From the early onset, neither New York City Health and Hospitals nor Fortune Society invited community input, nor were transparent with their plans and intentions. Our community was blindsided by this proposal, and after ever-changing guidelines were presented, immediate concerns were ignored and questions were left unanswered. Most concerning is the cavalier attitude of Fortune Society CEO Joanne Page. During a presentation to a community board in Manhattan, Ms. Page reduced statutory rape to mere Romeo and Juliet occurrences. I can tell you that as a father of a 7-year-old girl, listening to someone downplay and minimize the severity and repercussions of statutory rape is both repugnant and morally reprehensible. And when a stabbing took place earlier this year at the Fortune Society headquarters, Ms. Page's shocked reaction did not inspire any confidence that neither she nor her organization are adequately prepared to act or prevent any occurrences from happening within our community.
Thank you so much. Time's expired. You can certainly submit the rest of your comments.
Let me leave
right
you with
outside.
this.
Okay.
Despite
Your
current
time.
beliefs,
Time is
choices
expired.
and actions, your
Next
choices and actions
speaker,
have real life consequences.
Ryan Aquata. Thank you. Ryan Aquata.
Yes, hi. Thanks. You got the name right. I appreciate it.
Oh, good.
My name's Ryan Aquata. I'm a Bronx resident. I don't live in this neighborhood, but I worked in the courts for many years, and that's why I'm here. I'm hearing lots of people say people who don't live here should have no right to speak about something that's happening in this neighborhood. But I hear people talking about criminals and convicts and bad people, and most experience in this system themselves or have experience working within the system, talking to people who've gone through these things. And I just hear a lot of discrimination and anger. We don't want these people here in our neighborhood. And I'm going to say, as someone who's worked in the courts for many years, it was my job to screen people, to refer people to transitional supportive housing programs, to refer people to alternative to incarceration programs, to look at situations where people were accused of harming someone else and try to assess, along with judges and district attorneys and defense attorneys, what's the best thing that we can do for public safety to try to make the future better than whatever happened in the past. And I often referred people to Fortune Society housing, and they would get access to all kinds of services, employment services, education. People got their GEDs. And housing was the number one most important thing that people were struggling with. When I heard about this Just Home facility being proposed, I was thrilled because I had just been talking to people on Rikers Island who were in wheelchairs, people who had spent decades upstate in prison, who, when they came back in their last few months of incarceration, they couldn't be sent to local prisons because there's no wheelchair accessibility in local prisons. They have to send them to Rikers because there's like 1 or 2 out of the 10 jails on Rikers that's wheelchair accessible. And so I was talking to people who over their time in prison developed lung issues, heart issues, cancer, all mobility issues. And they're people that I couldn't place because the housing facilities that were available, accessible facilities, didn't have access to the level of care that these people would need. And I just really hope that, like, everyone in this community, I mean, it's like this happens in communities all over the city when we propose homeless shelters, when we want to cite housing for people who are seeking asylum. Like, people come out and they're angry and they think it's going to destroy the community. It's going to make everything awful, but it doesn't. Where is the evidence that in the neighborhoods where Fortune housing exists, that crime has gone up because of the Fortune housing? Like, you have no evidence to back up those claims. You're just saying things that you're scared of and saying that's what's going to happen, and it's not what's going to happen. So, no, you have no evidence, sir. You have no evidence. And so I'm here to tell you that the city needs this project. There are so many people languishing on Rikers Island who are only there because they don't have housing. All of our public safety is improved when our neighbors are housed and cared for. We are all depending on projects like this. And so I ask you to please approve the Just Home project because New York City needs it. The Bronx needs it.
Thank you for your comments. Next speaker is Bonnie Massey, and after that, Austin Celestin.
Thank you. Good afternoon. My family bought a house on Seminole Avenue in 1980. And I grew up in that house, and my family still owns that house. My daughter goes to school. She's 4 years old. She goes to school at Bronx House down the block or a little bit up Pelham Parkway. And I want to say that I am in favor of this project. I'm embarrassed by other folks in our community who can't see the benefit of it. And I'm like sitting here kind of shaking a little bit because it feels also really personal and really emotional for me. And so I was just saying to somebody, like, I'm trying to understand why so many of the people in the community have spoken against this. And I think I'm hearing a lot of it is about safety. And so I want to speak to that for a second. I think people have a really false, like, magical thinking about safety because there are formerly incarcerated people walking around this community all the time. There are people who have been locked up in this hospital, probably in this room. They're walking down Williamsbridge Road. They're shopping in CVS next to you. There's not a gate around this community. So if you think that there's not these people already here, they're already here. Like, we're kidding ourselves, right? Like, people who are formerly incarcerated, some of them are veterans, the same communities that we're talking about. Some of them are people who a lot of them are people who are dealing with domestic violence, right? A lot of them are elders. A lot of incarcerated people with health issues are elders. So a lot of these issues, they come together, you know, and the way that, so I feel like people have a false sense of what we're actually living. Same thing, people are worried about pedophiles. The majority of sexual assault happens for people from somebody in their family, you know? So we all want to be safe, and I'm just concerned that my neighbors are living with the idea that we have this incredible sense of safety when in fact, I think a project like this makes our community more safe. And, this specific community, but also the larger community, in the sense that it's proven that a lot of recidivism and stuff that does happen with people who are incarcerated, people who are addicted, people who have mental health issues, is because they don't have the supportive housing. They don't have, right? That's how these things happen. It is true. And so for me, right, when we look at like the subway now, my son goes downtown to school on the subway, and I'm like, oh, we're all up in arms about the subways are unsafe. The subways are unsafe because those people don't have nowhere to live. And so I think at the bigger picture, it keeps us safer. And it keeps all of us safer. So I want to say that. The other piece, and then that's like the part of me that feels like I can relate to what y'all are saying. And then the other part of me is also like, it feels a lot of like, other people can deal with these people, but not me. Not me. I don't want this. That I don't have to do this. And that feels like discrimination. It feels a lot like other things that we've lived with in our city and that we continue to live with that are really a problem. And so those are two things, I guess just two things that I want to say. And also, no one is saying that we shouldn't support veterans or that we shouldn't support other vulnerable populations, but supporting one doesn't mean taking away from another. It really doesn't. What we should be doing is demanding that we get funding for all of the vulnerable people. And I don't think it's right to say, this is the only community that shouldn't have these people. We are a solid community. So we do have the ability to support folks in ways that maybe other communities that are less solid can't. And so, we want to keep saying, send them to Lincoln. Lincoln Hospital is also in a residential area. It's just not as people haven't been able to buy houses as much who live there, but it's still residential. And everybody's kids matter. And everybody's kids' safety matter. Everybody's family. Anyway, I leave it with the point of let's not be fooled about what safety looks like. And if something does happen in this community in the future, it's not because there's just housing here. I was assaulted at gunpoint when I was 11 years old on Seminole Avenue. There was no just houses here then. So, if something does happen, I don't think that we can say, oh, it's because of this. So I just really think about what safety means to us. Thank you.
Thank you. The next speaker is Austin Celestin, and after that, Eric Shope.
Sorry, I'm also a little bit vertically challenged. Good evening. My name is Austin Celestin. I'm an urban planning student at NYU, and I'm a member of Open New York. And I have family who used to live in the Bronx a little bit further north in Wakefield. If housing is something the city lacks as a whole, then it should be no surprise that affordable and supportive housing is non-existent, particularly in this area. The formerly incarcerated and medically complex individuals that this project will cater to are some of the most vulnerable people in this city are at the most risk for homelessness, an issue that becomes ever more critical in the winter months that are approaching, especially with our homeless population reaching and crossing 100,000 people. Housing like this is a critical need, and for those with medical conditions, supportive housing right next to a hospital like this that can adhere to their needs is exactly what we need. Housing is stability, a foundation upon which those who have exited our criminal justice system can rebuild their lives from. I won't throw stats at everyone, but I can give just a little bit of a summary. This area has a higher median income than the rest of the borough and has contributed among the least amount of housing in the borough and at the city at large. Every part of the city needs to step up and play their part. And it's time this neighborhood does the same, as should every other neighborhood in the city. And right now, there's an opportunity before us. People have mentioned other forms of housing, supportive housing for seniors, veterans housing, domestic housing for domestic violence victims. Absolutely. Build it all. Build it everywhere and anywhere. We're desperately lacking in all those areas as well. They should be built alongside this project, not in lieu of. When you're saying that one good replacement should replace another, that's not a win. That's lost housing. That's delayed housing. And housing delayed is housing denied. The need for supportive housing and security will remain critical. Switching the projects also starts the clock over again. If you remember, about 3 hours ago when they showed the presentation, they said 2026 is when this building can open. And that's after a year plus of this process and a year plus of these meetings. We're saying now, start the clock over What's it going to look like then? What's our housing crisis going to look like in 2026? What's our housing crisis going to look like if these alternative projects ever even come to fruition? And we should be putting the gas pedal on advocating for supportive housing, for veterans housing, for senior housing right now, not just because this project is coming up, but because it's the right thing to do and because it's something that the city, this neighborhood, and the state desperately needs. Those requests should not only be coming up as an alternative to this plan, they should be coming up as a supplement, as a complement. Sorry. Everyone deserves a foundation, a safe, warm, and secure roof over their heads. We talk about recidivism so much, but the best thing that happens to people who exit our criminal justice system, the ones that have the best outcomes are the ones that have a roof over their heads and are not thrust back out onto the streets, struggling to survive, especially when the temperatures start to dip below freezing, which I know is a little bit of a rare occurrence, but that's a different story. We need this supportive housing. We need this project. It addresses the needs that so desperately need to be addressed. And we also need all the other alternatives alongside this project. This is not an either or. This is an and proposal. So if you support all of this, support this as well, and support everything as a collective. Thank you.
Thank you. The next speaker is Eric Shope. And after that is Peter Del Debbio. Eric Shope. Peter Del Debbio. And our last speaker then is Kylie Clark. Okay. I will call this hearing to a conclusion. Thank you so much for sharing your comments and have a good evening. Get home safely.
Good evening.